as a public health nutritionist, I've always felt that we were like an only son or an only child because we've been involved in the preventative more than the curative until I read about the arrival of this very important event that is going to take place. So, for me, responding to public health emergencies couldn't have come at a better time. Then together we can work collaboratively to address the challenges that is confronting us. Now, if we're able to do this, what it therefore means is that when an epidemic or a pandemic comes, we'll be ready. So that kind of investment is very important for that epidemic preparedness. So the collaboration between SEND Ghana and the Global Health Advocacy Incubator could have come at a better time to bring about policy change in our country. Now, for me, I'm excited that we can see this. And to kickstart the event, we have quite a number of people on Zoom already. We have quite a number of dignitaries who are here, and I'll be calling them forward. And maybe I would rather call them now, and then we would have the opening prayer. So without wasting much time, I want to call to the podium Professor Paul Amuna. Yeah. So Professor Paul Amuna, is he here? Please, you are invited to sit on the podium. Yeah. The next person is Professor Evelyn Ansah, Director of Malaria Research Center, IHR. The Vice Chancellor will be joining us shortly. Traffic. Then we have Professor Fred Newton-Binka. Then we have Dr. Emmanuel Ayifa. Is he here? Please. Now, this is what we're going to do. We don't want to crowd you here, so we're going to have the first session. And these individual distinguished guests will be involved in the first session. Okay? So if I haven't called your name or we haven't called your name, don't feel offended. Okay? We just want to give them plenty of space so that they can flow. Thank you very much. Now, without wasting much time, can we call Dr. Mavis Pearl Pabla, a lecturer at Fred Newton-Binka School of Public Health, to give us the opening prayer.
Good morning. Can we kindly be on our feet as we pray? Father, in the name of the Lord Jesus, we would like to thank you for our lives and even for this gathering. We are grateful for granting traveling mercies for all our invited guests and every participant coming from both far and near, and even those who are yet to arrive here. Father, we thank you for their lives. This morning we are here to brainstorm, to plan, to strategize for the emergencies that confront us as a nation, as a country, and even as a world at large. Father, we pray in the name of the Lord Jesus that you will stir the affairs of every activity to a successful end. May all our deliberations be fruitful. May every activity be carried out as planned. And Father, we will never forget to give you praise. We thank you and we give you all the praise. In the name of the Lord Jesus, I pray with thanksgiving. Amen.
Amen. Thank you so much, Dr. Pearl Pabla. Now, the Vice Chancellor of the University of Health and Allied Sciences, in the person of Professor Lydia Ziato, is in our midst. VC, Prof. 1, welcome. You all have a copy of the program, and so I have skipped the reason why we are here, And you can see the theme, which is the public health emergency funding, the role for academia. I wouldn't want to waste your time, and I would want to invite to the podium to kickstart this event Professor Paul Amuna. He will give us the welcome address. Now, Prof. Amuna is a physician scientist and occupies 2 fellows, not only in the Royal Society of Medicine. He's a nutritional epidemiologist and also a fellow of the International Union of Nutritional Sciences. He is currently the acting dean of the Fred Newton Binka School of Public Health. He is a pedagogy expert with over 30 years experience and has been involved in several initiatives. Without wasting much time, I would hand over to Professor Paul Amuna to give us the welcome address.
Thank you very much, Professor Francis Otto, for your introduction. Vice Chancellor, Professor Lydia Aziato, University of Health and Allied Sciences. Director of Research, Ministry of Health, Ghana. The CEO of the Whole Teaching Hospital, Dr. Tampuri. Distinguished ladies and gentlemen, students, I am delighted to be here to kickstart our dialogue this morning and want to warmly welcome all of you to this event. Gathered here, we have our partners from the Global Health Advocacy Incubator and their local partners, Send Ghana, with whom we have come together to establish this forum, a forum for advocacy for public health, with a particular focus on public health emergency funding for Ghana. Now, to do this, we recognize how important it is that we in academia work with partners in civil society and other stakeholders. And so, as a university, we thought it right and proper to invite our colleagues from sister universities across the country. And so I'm delighted to note the presence of our colleagues from the University of Development Studies in Tamale. We have colleagues from the University of Cape Coast, from the University of Ghana, and from the University of Environment and Sustainable Development at Somanya. I'm also delighted to note the presence of our visitors from York University in Canada. So I'd like to welcome all of you as well as our stakeholders from various parts of the world. I forgot to mention the presence of the Pro-Vice Chancellor, Professor Harry Tagbo of Uhas, who is also here. Why are we gathered here? We are gathered here because public health and public health emergencies are an important part of our lives. As recently as 2014, we had a major epidemic in the West Africa sub-region of Ebola. And during that crisis, we saw what happened, the devastation across countries like Liberia, Sierra Leone, Guinea, and to some extent, Ivory Coast and Senegal. Why? Because as a result of the Ebola virus and very weak health systems, poor infrastructure, and a lack of the right human capital and the resources, it took some time for this to be contained. Now, globally, countries over the years have made pledges, signed commitments, made agreements, and taken actions in order to prepare for public health emergencies. There is nothing better than being prepared for an emergency. Preparedness means that we have to have the right kind of infrastructure, we have to have the right kind of human capital, and have the resources that will be necessary to kick into action when such disasters occur. I have to say that we in Ghana have actually done well in terms of our health infrastructure. You visit some countries in Africa and you then realize how blessed we are in terms of the setting up of hospitals, health centers, clinics, and now we have the CHIPS, which are the mainstay of our local community health services. I was in Ethiopia 5 years ago now, and during my visit there, we were at a conference, and one of our distinguished professors fell suddenly ill, and we had to rush her to the nearest health facility. And I was saddened by what we saw when we got to the place. It was supposed to be an accident and emergency unit, and the health personnel there did not know how to use an ambu bag. This was somebody who had ceased breathing and needed to be resuscitated. And I stood there helpless. We could only make suggestions. And the ambulance that was supposed to carry this patient to the specialist unit, which was about some 20 minutes away, on the way, we heard that the ambulance, there was an accident somewhere, and the driver had to divert and go and pick the patient and bring the patient to this very place before sending our patient. Needless to say, we lost Professor Sidiga, and I saw it with my own eyes. That just puts into perspective the level at which we are operating. Our health systems, the infrastructure, the personnel, and things like that. I think today we are going to have a lot of discussion around why it is that we need to make the case and advocate for public health emergency funding for Ghana. Now, we as academics need to partner with civil society to make our voices heard. Advocacy is something we do not do very well in the health sector. We have a product. We don't know how to sell it. And so it is very easy for people to just, throw rings around us. And sometimes people profit from what we are doing. Recently, we had a global pandemic, and people became millionaires out of COVID-19. But the economy got worse, and we still have a long way to recover from that. Again, that puts into perspective how important today is. I wouldn't like to go on, otherwise those of you who know me know that I can speak for 5 hours. But I'm glad that we are all here. We're going to have a wonderful day, and so once again, I welcome you on behalf of the partners, Ghai, Send Ghana, and Uhas. And we at Uhas are very proud and happy that you have chosen us as partners. And we hope that this symposium, being the first, will certainly not be the last. And that it will help us to work closer with our civil society partners and develop guidance to support government in its efforts to promote health and well-being in Ghana. Thank you very much.
Thank you very much, Prof. Amuna. Without wasting much time, I would call on Prof. Amuna again to welcome the chairperson for today's event. But you see, he made an important statement. Nothing better works than to be prepared for emergencies when they come. So we are here to make the case. You and I are here to make the case. But without wasting much time, Prof. Amuna, if you can invite the next speaker. Do I introduce her or you do the introduction? Okay. The next person that will be coming, the chairperson, is a distinguished public health physician and epidemiologist par excellence from Ghana. She has been involved in the malaria policy advisory group of WHO, which is the World Health Organization, and an independent evaluation panel of the Global Fund. This person has worked extensively, internationally and nationally. I'll leave Prof. Amuna to mention her name and invite her.
So our chairperson for today's event, as has been mentioned, is a very experienced professor of epidemiology, and she's also a reverend. I like to mention that Professor Evelyn Koko Ansa is the chairperson who is going to steer us through this symposium today.
Thank you very much, Madam VC, the Pro Vice Chancellor, esteemed colleagues, ladies and gentlemen. I will stand on all the protocols that have been laid down already to say that I'm very much honored to be asked to chair this very important program. This program actually has national significance because it's important for our collective health and our very survival as a nation. The recent COVID-19 pandemic taught us many lessons, but I believe the key lesson and the most important lesson that we were taught is the fact that preparedness is critical, because we all saw at a time, at a certain point in the whole pandemic, where all borders were closed, all countries were to themselves, and what it was each country to itself and God for us all. And so being prepared is a very critical thing. I believe the carefully selected speakers today are very well placed to elaborate on this very important subject. And I wish all of us a fruitful deliberation. And once again, I want to thank very much the organizers for asking me to chair this very important program. Thank you very much.
Thank you very much, Professor Ansa, for accepting to chair this event. There are two people I've noticed. I know Prof. Amuna mentioned the CEO, but he's in the very person of Dr. You know why you get a mind block? But we have KNUST also represented here. So thank you very much, Dr. Tete and Wama. But Dr. Tampuri is in our midst, the CEO, always seated incognito. Now, we're going to start our presentations. We have here in our midst the first person to kickstart the presentation in the person of none other than the Vice President, Prof. 1 of the University of Health and Allied Sciences. Prof. Lydia Ziato is the Professor of Oncology of Nursing. She has received numerous awards and fellowships, President and Board Chair of the Chi Omicron at Large Chapter of the Sigma Theta Tau. You see, give credit where credit is due. And so it is our privilege and our honor to invite Professor Lydia Ziato to give the first presentation.
Thank you very much, Prof. Ziato. Good morning. Good morning. Our distinguished Pro Vice Chancellor, you are sitting too far away. You should have come to the front so we can see you well. Welcome, Pro VC. My astute deans and directors here present and online. My foundation Vice Chancellor, our distinguished Prof. Benka. I'm happy to see you, and that I'm happy that you are well. Happy birthday in advance. You'll soon be 70 years this month. So we also have very distinguished speakers among us. I acknowledge all of you. We also have our partners here present. May I see a wave, our sister university, UDS, if you can give me a wave. Welcome. KNUST, welcome. I also have UNAIR, right? Do you have UNAIR? Oh. You went to Environment and Natural Resources. Are you here? Welcome. Any other? University of Ghana? UCC, where are you? Okay. Welcome to our very beautiful university. Is it your first time or you've been here before? You've been here, okay. So you're welcome back home. I pray you come and join us. All right, and our summer school participants, you are welcome. Staff, students, acknowledge all of you. I also know that without an organizing committee, this would not have happened. So, organizing committee, can you give me a wave? Well done. Well done, well done, well done. And again, I want to commend the School of Public Health, Fred Newton Baker School of Public Health, for bringing this together. Give me a wave if you are here. Oh, Dr. Wak, are you not part of? So congratulations to the school for making this happen. And I encourage other schools to emulate this laudable activity. I also want to commend the ICT team and Public Affairs Directorate for working with the school to make today possible. Well, so they wrote keynote, but I doubt whether what I'm going to say is a keynote. I just want to set the context for your deliberations today. And I hope that by the end of the day, something good will come out of it. I don't believe in talk shop. I believe that after the talk, something has happened. So I'm hoping that as the years progress, we will see the outcome of the various talking that would have happened. I also think that without the talking, people do not really understand what is going to happen. So the talking is very important to lay the foundation. So this symposium is very, very, very important for me. I'm looking at a day where a Uhas alumni or alumnus will be the Minister of Health or the Director General of the Ghana Health Service or any other person that would be wearing the shoes for these things that we're going to discuss today to happen. And I want to encourage the various schools to include in their curriculum and various programs skills of advocacy. An advocate is not that somebody who talks and talks without substance. An advocate is somebody with multiple skills and in-depth knowledge in multiple areas so the person can make a case and make it clearly. And so I'm hoping that as the years progress, our programs will incorporate advocacy skills so that when they finish, they can be good ambassadors for the various issues we champion. As an academic institution, initially when I saw the topic, public health emergency funding, role of academia, the first thing that came to mind is Uhas is a health university. We are talking about funding. Shouldn't you go to a program where they run economics and health financing? Then I look at it and I went back to our ethos and values. And what struck me there is service and care. If we do not advocate, how do we provide service and care in our communities, nationally, internationally, if things are not done right? And like Prof. Amuna gave the example a moment ago, they lost a colleague. Even if you are an expert and you are far away and you don't have the resources to work with, you don't have the items that you need to make that life live, what care will you provide? What service will you provide? So I think that Uhas is the best university that our partners have selected, and we are grateful that you selected us to lead this agenda. So our ethos, apart from service and care, include excellence, integrity, innovation. And you can only innovate, you can only provide excellent service if you have the necessary funding thereof. You can only innovate and provide excellent service if you have the necessary funding for the things that we need to provide the excellent service. So for example, we talk about hybrid programs, and we do not have the items as a university to stream. As I said, some of the times we have to go and rent items to use for this process. We are lucky to find it to rent. What about when we are in an area that we don't even have it to even rent? So I'm saying that it is important for the University of Health and Allied Sciences to aggressively, actively engage in this area of health financing. And because we have a whole school of public health, it means that anything that has to do with public health emergency funding, we must lead the agenda. That said, I have a few things that I want to draw our attention to as the day progresses and various speakers come through. I'm actually not reading my speech, so I'll leave it for the organizers and make it available to our participants and partners. And perhaps, I'm not sure whether it will be published on our website so that you can read the full complement thereof. We already know, as Prof. Amuna laid the foundation, that some emergencies happened in the past. Ebola, I don't want to belabor the point. We also know that every year, in some endemic areas, we have some health challenges, so we can prepare adequately for it. We are very, very much aware, all of us here, that over the years, our governments have tried their best to provide health services across the various levels. And we also tried to use different models of health financing or funding of healthcare over the years. What we have now, which is the National Health Insurance, we all know the deficits thereof. And I dare say that for some facilities, it is still cash and carry, which is unfortunate. At the time I was training in the 90s, it was cash and carry, and it was heartbreaking to see somebody recover, and because the person cannot afford, the person is being kept on the ward, and the person will get another disease, nosocomial infection, because the person is still on admission. It was unfortunate. So the social welfare services will be going up and down, and our family members will leave us. Unfortunately, when we die, they hear it earlier and they come for the body. It's unfortunate, but it's something that happened, and I can say that in some facilities, it is still a present tense occurrence. So the issue about normal health care, funding normal health care, we can discuss this to the end of the day. But that is not why we are here. We are here to say when the unexpected happen, and it happens such that all of us, we are at risk, or our lives are at stake, in not one, not two, but in hundreds and thousands. What do we do as a nation? That is why we are here. And so, under the international health regulations, policies, and directives, countries are bound to better prepare for and detect and respond to pandemics or epidemics. We are bound to. But as a country, are we ready? Or have we made the attempts? Or how far have we gone to be ready? So this symposium, I believe, would bring speakers that can help us better advise, better work together with our different partners to be able to get ready, detect and respond appropriately when the unexpected happen. Let us remember that it is not only epidemics or pandemics that this discussion is important for. Once we have the funding or the funds established, remember that we can also have disasters, which can be man-made or natural. If that should happen today, here in Ho or any part of the country or the sub-region, where do we stand? Can we really withstand that disaster? We are lucky that our country is not found in disaster-prone earthquake. I don't know. We had some tremors in the past, but anything can happen with the climate change and global warming and all that. Anything can happen. Are we ready? And so we are principally relying on our consolidated fund. We are relying on constituency funding that came from left and right, and other loans and grants from our partners. That is historically what we have been relying on. But today's forum is saying that consolidated funds stay there, loans and other things stay there. But from our own efforts, we're going to set up this funding so that we'll be ready for anything, any eventuality. And I wish to reiterate that the discussion would dovetail into, so who owns the fund, who controls the funding, how do we make the fund grow, how do we ensure that the fund is not diverted into other things if nothing happens for the next 20 years? How can we police this fund? How can we? Not just establish it, and we cannot account for it or grow it. So I leave it for the speakers and the open discussion to have some recommendations, not just establishing, but how do we maintain it. Apart from that, the funding is not only for intervention when something has happened, but then this symposium should also discuss how the funding can be used to help us prepare, how the funding can be used to help us detect. That is where public health, this sits very well in public health. How can we use some of the funding to help us prepare, to help us detect and respond, or rehabilitate when the situation has happened? So post-recovery activities. I wish that this gathering will consider these as part of the advocacy dialogue. I wish to here applaud civil societies, the Global Health Advocacy Incubator, and our local partner, Send Ghana, for the commitment for advocacy, for the commitment to bring government to the drawing table. Ministry of Health, Ministry of Finance, our chief executive of our hospital, tertiary level hospital, is here. We want to thank you for this initiative. I have commended my own university already, so I don't want to belabor the point. So we are happy that the ministries that are very relevant for this discourse will be part of this agenda. I am also very happy again that a forum is being held in a university, the only university dedicated to train health professionals. And because we are the leaders in this space, I hope that this will not be a one-off event, but it will be an annual event in our calendar. And when we solve the issue of the health financing, we bring other areas that we can advocate for, and we become the leaders in health advocacy across the discipline from cradle to grave. As an academic and research institution, I also hope that this symposium would provide the necessary forum for networking and collaboration, and for our own to have some research in this space so we can publish together with the other partners from the other universities that we have here. I've been speaking for a while, and I think that I'm not the type that speaks for too long. So I wish to again thank our partners again for this opportunity for the university. And I hope that this inaugural symposium will generate very laudable outcomes to help our country survive. So on this note, I wish you all a fruitful day, and I hope that something good will come out of it. It won't be a 9-day wonder, but it will lead to a positive outcome. So thank you very much, Mr. MC, and thank you all for listening to me.
Thank you so much, Vice Chancellor, Professor Lydia Ziato. The second presenter is not new to us. He is an internationally renowned and was recently commended by the Director General of the WHO. He has been very instrumental in the establishment and the implementation of the CHIPS model, which I'm sure you all know about. I wouldn't want to waste much time. The sweetness of the pudding is in the eating. Now, the gentleman I'm going to announce to the podium, a whole school has been named after him. Professor Fred Newton Binker is a distinguished professor of clinical epidemiology of the public and a public health advocate par excellence, as I'm told. Without wasting much time, let's invite Professor Fred Binker to the podium.
So thank you very much. Yeah, okay. So I can put this in. So thank you very much for those kind words of introduction. I also wish to stand on the existing protocols so that I will go straight to the point. My invitation did not tell me how many minutes I was supposed to speak, but I can see I have to speak for 20 minutes. And so there's so much to be discussed in this session. I thank the Vice Chancellor for laying some of the questions that we need to focus on as we go through this whole process. So let me start first to remind you that what I was asked to talk about was public health emergencies, a global challenge and the implications for health systems and policies. I'm going to be very brief about this. I'm going to look at the global standards and leadership. I'm going to then dovetail a little bit into the international health regulations. I will look at Ghana and our current setup. I'll look at funding, and within that, I'll look at the issues related to health systems within this whole thing. So going straight forward, I think the global setup and leadership was established many, many years back. Our current international health regulations were passed and endorsed in 2005. And they are undergoing a review now since we've now been hit by a pandemic. And the major issue related to this was that the WHO, under its mandate, has the central and historic responsibility for the world, responsibility to help us manage global regime for control of international spread of disease. We all have our boundaries and we all have our governments, so we need somebody who will help us to work across the boundaries. And as you can see today, somebody will have breakfast in Ho, in this meeting, and may have lunch in London. So we are a small global village. The distance between one position and the other is very small, and we need somebody to be there. Yeah, it's the boom. I think your thing is a bit loud. If you can reduce that. Okay, so the WHO, under its Article 21A and 22 of the Constitution, confers on the World Health Organization the authority to adopt regulations designed to prevent international spread of disease. After the adoption of these regulations, this thing came into force. And the member states who firmly agreed on what was in the Constitution signed on. I think we have over 195 countries that have signed on. There are a couple of countries that have objected to the adoption of the international health regulations, but that is the purpose for which this was established. And secondly, the main goal is to prevent, protect against, control, and provide a public health response to the international spread of disease in ways that are commensurate with the restricted public health risk and which avoid unnecessary interference with international traffic and trade. Those last words are so important because we all saw what happened. There was a disruption in international travel, traffic, and trade. So this has been the major push, And WHO has been given the leadership to make sure that it can get all of us to start and to get on to control the spread of diseases across the world. But if you have had a chance to look at international health regulations, the key issue is that of preparedness. This is a war that we tend to fight with the disease. And when the first shots are, when you hear the first shot, it's too late. However prepared you are will determine how you're going to deal with this whole issue of a pandemic that is raging across the world at speeds that nobody can talk about, and also is killing more than even the bullets do kill and the bombs. So preparedness is the key issue to this, and I think the international and the global community has been trying to do this appropriately. As I said, this IHR was passed in 2005. The revision is going on now. I'm sure by next year, a revised version will come based on the lessons we've learned from this huge pandemic that we've all been through. But there are key issues related to that. The key issues related to this leadership is that there's an obligation on all state parties to notify WHO of events that may constitute a public health emergency of international concern and according to defined characteristics. Those characteristics are defined by WHO with support of a panel of experts. There are about 6 or 7 things, but I'm focusing on this first one. And the second one is that procedures for the determination by the Director General of a public health emergency of international concern and issuance of corresponding temporary recommendations after taking into account the views of an emergency committee. So even the WHO Director General has to get the support of an international emergency committee. Why? Because the disruptions and the messages that come out from the WHO can change the world in a minute. And some of you who are here and actively involved, I'll give the example of SARS. When the SARS problem came, there was one country that I was shocked got into the middle of all this, and that was Canada. The WHO issued an edict to prevent travel to Canada. And the Canadian Parliament had to travel to Toronto to eat meat for the whole world to see that there was no problem. That is the kind of powers WHO has, and those are the kinds of institutional directives that come if you want to restrict the spread of disease across the globe. Anyway, this looks boring to all of us, but these are the pillars that determine whether we're going to make it or not. We had Ebola in 2014. We were spared. Some of us were in the heat of this Ebola problem. I ended up in Parliament to answer with my lawyer while we were trying to find a vaccine to cure Ebola. And I met many people who used to call me in town, this is the Ebola man, you know. But the issue is that of preparedness. If we don't prepare, there's a problem. After the Ebola came, everybody went back to his business and we forgot about what needed to be done. We started to build infectious disease points. There was one in Tema. If you have time, please pass by the Tema hospital and see whether that has been completed. It wasn't completed. There was supposed to be one in Tamale and one in Kumasi. Nothing happened. Okay? Now, fast forward, pandemic COVID arrived. This time, COVID made sure everybody was called to stand and be counted. We were fortunate in this part of the world, and as you all know, I don't need to remind you, the whole globe was worried that many people in Africa were going to die and we would just be found on the streets. Because of what? We are not prepared. Our preparedness was very weak. Our health systems almost
walking lamely to try and solve the small problems like malaria, which are so easy to treat and to diagnose. So here comes a disease that is creating huge problems with even diagnosis. You needed what? A PCR setup to be able to diagnose it. And how are we going to find this whole business of trying to make it work? So the issues also of politics also came in. You've seen what has happened to the economy. Our president says the COVID was one of the key pillars that knocked our economy down. Yes, because it cut down traffic, it cut down on trade, and people had to survive first. We were doing very well until India got hit by one wave, and most of people in India were dying. So India stopped the export of vaccines to Ghana and to Africa, actually. And that started the panic. Every country in Africa wants to produce a vaccine, including Ghana. And we are on the path to doing that. So there is the global leadership. It makes sure that we have a leader who gives the orders, and then we all try to follow. These orders are already in place today. The world is saying, prepare for the next pandemic. It will come. It's only the date we don't know. But we are all agreed that there will be the next pandemic. We went from SARS, we went to Ebola, we've come to COVID. How are we prepared for XXX when it arrives? Will we be lucky again without being hit? No. So in summary, the global and international setup is very simple. It's protecting people every day. And what are the key things that are required? That we are able to detect, we are able to what? Respond. These are the key things about international health regulations. And this must not be taken lightly. If these things are not in place, then when the war starts, we will be at a disadvantage and many people will perish. Now let me go quickly to the Ghana bit. I've not talked about funding, don't worry. I'm not a great guy on the funding bit. What was Ghana's intervention? Ghana's intervention has been hailed, I'm told, around the world. We also know that we have been touting our credentials of getting these things going, but I will assure you that it was by the grace of God that we are all working around here. Anyway, we can talk about that in a coffee break. We had an interministerial committee that was chaired by the president of this country. Even the membership of this committee, if I go around this room, none of you will tell me who are the members. Does anybody know the members of this committee? Ministry of Health. I don't want to put you on the spot. So we are going to war, and we don't know our leaders. This is war. Who is the commander-in-chief? The president. But who are his left, right, forward, and back generals? What is so difficult about learning to know who are the leaders who are taking us forward? So that if we have some message to give, we can whisper into the ears of that person to help us fight the war better. That was one. Then there was a pandemic technical committee which was set up under the Ministry of Health, truly to provide us with guidance in what we needed to do. Membership of that committee still not known. Okay? So there are small things that we don't do that we need to do to what? Make us successful. Then we had, we effectively ran this whole business through the Public Health Division of the Ghana Health Service. Okay? And I will quickly show you how difficult those decisions were and the risk that we took under those circumstances. Down with the laboratory services, we're lucky to have Noguchi lead, and KCCR in KNUST helped this country to stabilize and give us comfort that we are able to detect this disease when it showed up. Finally, they expanded their role with other institutions like in academia. Uhas had a place here that was testing for the Volta and OT regions. We had the veterinary services, CSIR, and everybody coming on board. This took a lot of time. So it means that what? We are not prepared. If we are prepared, we will know where we are going when we get more than 10 cases, when we get it in more than 5 regions. People will know where to go to test and confirm their diagnosis and so on. Okay? Then we had the committee then took upon itself to help us go through this whole process. And when I was preparing this, I was a bit worried because the interministerial committee led us in this whole process. Great, because the president himself, the commander-in-chief of the armed forces, was leading the command to fight this deadly disease. However, they used methods that were not completely acceptable. And the first one I will tell you is that, look, GNA recently published that our Supreme Court said the imposition of restrictions by the president were unconstitutional. So were we prepared? No. If we were prepared, we would not be using unconstitutional means to fight a pandemic. Simple. Okay? And if you read the part of it that really worried me was that they claimed that this restriction of human rights and so on were actually not part of the Constitution, and it gave one person the order to say, you go to sleep today, next 2 weeks, you don't show up, even if you're hungry, stay at home, you don't go to church, you can't bury your people unless there are not more than 25 people will show up, and so on. But this is disaster. This shows that there was no preparedness. And preparedness is the key to what? To dealing with a pandemic. And we better learn from this and put in place the measures that are required. Then I went to look at what were the measures that were required. And the measures are in our Public Health Act, Act 851. I've copied verbatim most of the things that are within the Public Health Act. It's under actually Part 9 of the miscellaneous provisions. First, it talks about the patient charter, and then it talks about the international health regulations. If you look at this very well, this act makes the provision, adopts the World Health Organization's international health regulations specified in 7th schedule shall apply in addition to the regulations made under this part, insofar as a provision of the 7th schedule is not inconsistent with a provision of any of these regulations. The minister shall give effect to the international health regulations to provide a public health response to the international spread of disease. And finally, the minister may, by legislative instrument, modify the provisions of the 7th schedule to suit the purpose of the Republic. So I'm sure this part of the act had been gathering dust. I'm not sure they were ever looked at before the pandemic arrived. And that tells us that we know that there's an international health regulation that gives us global guidance, and then we have to adapt this for our own local use. If you go further, it tells us the declaration of public health emergency. So we had the act that allowed us to declare a public health emergency, and then we went on to make a law to restrict people. If you meet me at the coffee break, I'll tell you why the law was made. So our parliament, our executive, our judiciary sat back and watched. So for me, that's the basis. If you're not prepared, how do you go to war and win? Okay? So the Minister of Health had emergency powers in respect of public health matters. The minister shall direct a public health official to respond immediately to a public health emergency and may order an individual to take preventive measures or be quarantined. These were the tools we're supposed to use to control the epidemic. It also said the public health official may be authorized to act outside the area of authority of the public health officer himself. So this looked very straightforward and simple. But if you are honest with us, in this pandemic that we just are recovering from, our Minister for Health was missing in action most of the time. And for the first time, if you remember, we had to appoint Dr. Okoboy to become deputy minister to help to join the team. Because as we speak today, our Minister for Health is an accountant. The first one of the deputies is a retired customs officer. And I think the lady, I think she's, I don't know whether you can help us, but she's also not in the health area. So 3 officers leading our health team actually did not know what they were taking us to war to do. And not to talk about the commander-in-chief himself. You know, advisors are good, but advisors don't tell you. You can take the advice and you can reject it. And they've been doing that every day. If you're an advisor, it doesn't mean that you are the commander on the war front. Okay? So we sent a couple of people to war who were definitely, ended up losing the battle. Now, let's go on to the next, which I think is the major story for today, the establishment of the COVID fund. So the COVID fund was established by an act of parliament. It was to raise about 100 billion cedis to help the government in the response to the pandemic. The management, and it was managed by the Ministry of Finance and Economic Planning. Please take note of that. The government used the fund to support a variety of initiatives, including providing financial assistance to businesses and individuals affected by the pandemic, purchasing medical supplies and equipment, and supporting the construction of new hospitals and clinics. Obviously, something is wrong with this fund. We are talking of an emergency, and look at what the fund was being used for. Okay? I think supporting businesses and others should have come after we've controlled the fund. The basis of a fund is to control the pandemic, not to start building businesses when the pandemic is ravaging across the country and you cannot test people. You don't have ways to treat them. And then you start building hospitals and clinics. When will you complete a hospital for the patients to come in? You want the pandemic to last that long? No. Okay? So what did we find about that? The board was widely criticized for its mismanagement of the COVID fund. And I'm really depressed about that. Because the chair of the fund is a very good friend of mine. The retired, her ladyship, the Chief Justice of the Republic of Ghana, Madame Sophia Akufo. Some of the criticism levied against the board include lack of transparency. They did not release detailed information about the money that was spent. This was made difficult to track. It made it difficult to track how the money was used and to ensure that it was used effectively. There was lack of accountability, and in general, the public felt that the funds were mismanaged. So, I reminded you of what was written about the establishment of the fund. And if you are going to establish a fund, please wake up. They made a mistake, and the mistake is simple. This fund was managed by the Ministry of Finance and Economic Planning. Its first use of the money was to support businesses. It was not to support the pandemic. So when we are creating a fund, let's be careful how these things are established, because the Ministry of Finance just knew that there was another pot of money, and he was the one who made the decisions as to how the money were being used. But the poor board was then what? Criticized for not managing the funds well. So what are the lessons briefly that we've learned from the COVID? Just a few highlights of some of the things that I'm not going over all, but I'm trying to put this in context to look at the funding issues. One, we have a weak health infrastructure and a weak healthcare system. We can debate that for a whole day. The importance of a multi-sectoral approach to crisis management and the value of leveraging expertise from different domains was clear. We got a veterinary, we got the Greek people, CSIR, the universities, the schools, name it, all came together to help us what? Deal with this. It was not a Ministry of Health and the Ghana Health Service agenda. The necessity of providing accurate information and educating the public on preventive measures to control the spread of the virus was key. Okay? Do we have a system to make sure that we are accurately reporting what is happening? The answer is no. In fact, if most of you who were following the pandemic did not know, we were really worried that the teaching hospitals data were not part of the Ghana Health Service data you were seeing there. So you were only seeing one side of the mirror. And we will get to that. So the Ghana Health Service is set up in a way that they don't run the teaching hospital. Today, the CEO is here. He will tell you, since he was made CEO and this hospital was turned into the whole teaching hospital, we report to the minister. We don't report to the regional director. We can inform him, but that's not the line of report. If he has a problem at the hospital, he doesn't go to the regional director who is next door. The regional director is an official of the Ghana Health Service. Okay? Then they need to strengthen its research capacities and invest in local scientific expertise. Were very clear. Were extremely clear. But we messed up. Seriously. This is something that continued to worry me as I try to retire fully. KNUST developed a test kit just in the early days of this pandemic. And we killed it. We had outrageous standards set by the Food and Drugs Authority. I don't know where they came from at the time. When there's a pandemic, we are struggling to define and to control. If you found a test that was 40% sensitive, its specificity was low, was it not better than the test that we were using? What was the test that we were using those days, in the early days? Can anybody remember? Well, let me tell you, we're using the thermometer gun. When you are going to the place, when they point it at you and your temperature is not correct, they say what? Go away. You are suspected to have COVID. So, I couldn't just understand. We had these guns everywhere. When you're going to the mall or the market, everywhere they were chasing people. But we didn't then give these guys money to improve on the test that had been homemade. Okay? That's another story. We'll talk about this some time ago. But briefly, this is where I want to focus my attention to lead to the issue of having the, the funding established. Now, one of the two critical things that we took out from the COVID was that there were not enough health facilities across the country. So we rightly started what is called Agenda 111 to increase health infrastructure. Okay? 111 hospitals. Goodness. That's a great idea. But why couldn't we just say, okay, this year we'll build 20. Next year, 20. Till we get to what? 111. So far, we haven't built any. Okay? When is the first one going to finish? And I have colleagues who ask me every time when I travel abroad to these meetings, where did Ghana, we want to come and learn how you are able to build 111 hospitals. I'm not sure there is any country where they've done that before. Go at 111 hospitals in 18 months. Remember, that's point number one. The second thing that we started doing from the COVID was that we saw the effect of the supply of vaccines from India. So we set out to manufacture vaccines in Ghana. We have established a joint manufacturing group called DEK. Those of you who don't know DEK, it has to do with Dapong, Ernest, and Ekida Pharma. 3 local pharmaceutical companies were coming together to manufacture vaccines. And then we set up a committee to make sure that we can manufacture the vaccines here in Ghana and produce them. Out of that, we've just inaugurated a vaccine institute. It's at the Cantonments area. We've established a vaccine institute. I think the first director is Professor Anyidoho. Okay? But look at some of the things that I showed you as a summary of what we needed to do. Are we able to detect? Are we able to report? Are we able to assess? And what? Control the diseases. So we've just gone on a tangent. The truth of the matter is that the Agenda 111 will have many uncompleted structures in the bush at the end of the day. That's the truth. You all know it. I've not seen the budget for the equipment. Building brick and mortar is not a hospital. If you can't find money to build a brick and mortar, how are you going to fund the equipment? Number 2, have you made preparations for the human resource that make the hospital function? As of yesterday, I had 6,000 nurses have gone to real greener pastures, and more will follow. 6,000. This is not a joke. Okay? Today, you have many doctors finish their house job, they stay home for 2 years. What do you think they are doing in those 2 years? They are looking how to live. I mean, if you can't employ them, they can't be unemployed forever. Okay? As for the Vaccine Manufacturer Institute, I met my good friend, the leader of Kina Pharma, and it was just a joke. Look, vaccines are tools that we put into people who are well. We don't vaccinate those who are sick. So you cannot ethically put something into somebody who is well and make him sick. You agree? These vaccine institutes are now being built. These are simple processes they are going to go through. They have to generate their first products and develop their SOPs and then get ISO certification. Nobody can produce a vaccine unless you are the local manufacturer of the vaccines in my village, Loba. That you don't need ISO certification. Here you can make a vaccine from there, and they're making a lot of them. It takes about 2 years to get the ISO certification. So what is the hurry? Why can't we get this in the stream of things and leave what needs to be done? Anyway, I can spend the whole day on this, so I don't want to. I'm wishing them well, and I'm looking forward to the first vaccines being produced before the end of next year. Then comes the almighty health systems. When you invite me, don't add health systems to it. I'm not a health systems expert. I'm a very simple-minded person, and I look at the system. This is the organogram of our Ministry of Health. Go to their page, you find this. It's there. This is not a health system. It doesn't help us. So you see this box here. Yeah, well, this box here is the real meat of the ministry. So what I did was that I took it out to show you. But remember that Everybody here responds to the minister. Okay? All his directors are here, name it, whoever. In addition to that, he also is the one who deals with all of these people. The Ghana Health Service, 16 regions. The teaching hospitals, now 5. The quaternary hospitals, the mission hospitals, the quasi-government hospitals like the Bank of Ghana Hospital, and all of this under the Ministry of Health. In a structure that doesn't make sense. How can the minister work? Okay? So what happened in the COVID was that Ghana Health Service is on its own, and it's at par with the teaching hospitals. They don't speak to the teaching hospitals. They don't take instructions from the Director General of the Ghana Health Service. So, they can agree to give their data to the Ghana Health Service or not. And in a pandemic, we can't afford that. When you put out the data, it's the national data, which includes what? All these agencies. Okay? Not to talk about the private hospitals. Do they provide data to the Ministry of Health? They don't. You see? So this is a major issue that we need to fix. Okay? But we have to get on with it. When we got the little money, what did we do? We didn't fix the health services. And you are trying to create a fund. Where will the fund sit? Let's move on. So we got 100 million to start up the Agenda 111. Look, sometimes I'm not sure how these things work. But at the last count, we were told that the Agenda 111 would cost almost $1 billion. When you get 100 million, you don't start to build 111. You have to face it in. Or now you have started 111 hospitals all over the place. Have you got the 900 million? Now we are to IMF. Big IMF comes and says, I'm sorry, you can't be investing in capital expenditure when you can't find money to pay your salaries of your workers. Or you can't give textbooks to your school people. I don't want to get into that politics. I'm not so great about that. But what then makes me sick is the next, listen, this is Kolebu Teaching Hospital. So what about the existing hospitals? When was the last time they received equipment? Some of those hospitals are not fit for purpose. And as a public health person, I have one simple criteria that I use when I visit any institution. Very simple. You want to know? Yeah. I just go to the toilet. When you open the door to the toilet, you understand what that institution looks like from the public health aspect. You will close the door immediately. Okay? That is the problem. These things are breaking down. How can you go to this place and go back home? Only by the grace of God. Okay? So some of this money should have been used to fix the existing facilities so that at least before you build your this in 18 months, something would have happened. Some of this money should have come to whole teaching hospital to upgrade it, gradually upgrade it to be a teaching hospital that will be part of the system. No, when this hospital was upgraded to teaching hospital, the minister came with his two bare hands. He didn't bring any equipment. He didn't bring any pickups to give to us. He came with 10 fingers and went back. CEO, I'm not saying you told me, but I know I was here. I was here myself when this was done, and he didn't tell us what he brought as a gift to the new hospital that was established. The ceremony was here. I was here myself. Okay? So these are some of the problems that we are going to face in our preparedness. Let's go forward quickly. Now, I decided to look at the National Health Insurance because you want to create a fund, is that not? Then there are many funds already. Why don't we look at those funds? And the same problem is there. This is the National Health Insurance Act, which was passed by Parliament. It tells you the collection of levy is clear. I don't want to go through it. Is the collection, the agency determined by the minister responsible for finance. Then it goes to payment of levy into the fund, and it says the minister responsible for finance shall, within 30 days after the collection of the levy, cause the levy to be paid directly into the fund and furnish the minister responsible for health and the authority with evidence of such payment. The minister responsible for finance shall present to Parliament every 6 months a report on payment of levies into the fund. So where is this thing they call what? Arrears in this act? Maybe my English is not so good. So, I mean, we have, if you go to these people, they have arrears to what? 12 months, 14 months, 15 months. Please be careful. Part of the problem of these funds are from the Ministry of Finance. So my first advice to you is that try to find a way that when you establish the fund, practically it's not dependent on the Ministry of Finance. And I will give some examples. So it says timely disbursement of the funds is important. Otherwise, you don't go back and say the National Health Insurance is not working. And in this case, with a pandemic preparedness fund, we can't accept arrears. Do you know when the pandemic is coming and you are calculating arrears? Okay? So I hope you take that. This is not a joke. So the other thing is that there is no meaningful investment is being made to grow the funds. So if the NIH fund is in arrears, how can it invest to grow the fund? It's always in arrears. Money doesn't stop there. And I went to look at the disbursements. I didn't want to show you all of it, but I was shocked. In 2021, the Ministry of Finance and Economic Planning disbursed 6% of the money collected to the National Health Insurance. Did he go to Parliament to tell them every 6 months? So some people can just flout the law. Huh? Last year, 2022, he disbursed 0%. I don't blame him. If 2021 he disbursed 6%, nothing happened. So he's gone to the next stage, 0. Next time he will sell the buildings. So there are some other gaps that I've identified that are not being addressed. First and foremost is which institution takes over the networks that were set up post the pandemic and to prepare the nation for the next pandemic. Is it the interministerial committee? Is it the technical task force of the Ghana Health Service? So who benefits from that? When we dealt with Ebola, we started building those buildings, as I told you. Nobody, after the Ebola left, everybody went to sleep, and everything we learned at the Ebola time, lost. The second thing we need to look at, and there are many more, is the health system. The current health system needs a major review. It is not fit for purpose. So, I don't want to be putting pressure on my CEO of Ho Teaching Hospital. If you are a patient in Ho Teaching Hospital and you wanted to go to Korle Bu, because Korle Bu is more endowed than us, there's no system. Ho is independent of Korle Bu. Korle Bu is independent of Konfanochi. They are all at the same level in this hierarchy. Ghana Health Service, teaching hospitals, all the 5. There's nothing links them. They all just report to the Minister for Health. So their data and everything is completely in their box. So for example, in the Volta region, we've lost a lot of information because if the whole teaching hospital doesn't provide the information, there's nowhere to find it. You can go to the DIMS, which provides the information for the rest of the region, but the whole teaching hospital is not on the DIMS. We need to do something about this. Then there is the law for Ghana decentralization plans. Very soon, local government is preparing. And we are supposed to be decentralized. So this system we are keeping now, how does it fit into the decentralization process? I've not heard of a meeting that has discussed this in the recent times. Okay? So, no, I've gone back. So, what is my proposal? Seriously coming to an end. I think that for preparation for a pandemic and response, we need to set up a Ghana CDC. I always say this, for the past 2-3 years, I've been saying this at all meetings. Now there's a new nomenclature. People are calling it public health, something. I can't even remember that. But I continue to repeat that the issue of the naming of that institution is already settled. Africa has developed an African CDC. So why are you naming your child differently from the African CDC? It has 5 regional subcontinental offices and laboratories. Okay? So this should be able to take custody of all the lessons learned, the networks developed, and that can lead to the preparation for the next pandemic. Is it an agency of the Ministry of Health? Or definitely not a unit under the Public Health Division of the Ghana Health Service? A CDC is bigger than the Ghana Health Service. That's why people in the Division of Public Health don't want to hear about CDC. They want another name that allows them to create this as a unit. It never worked. It will bring together several independent institutions, academia, veterinary services and agri, private health institutions, Ministry of Local Government, research institutes, and so on. And they will support us in what needs to be done. So Ghana needs a functional coordinating body directly under the presidency and not under any ministry to effectively coordinate the key agencies who are key players in responding to public health threats. This highlights the need to establish a Ghana Centers for Disease Control and Prevention. It will provide the opportunity to strengthen its systems in the areas of preparedness, detection, and response. And if we can prioritize and invest in systems to find, stop, and prevent epidemics, we'll be better prepared to saving lives and protect our economy. And this is just for you to look at. These are some of the things that it will do. It will strengthen the workforce development. It will look at emergency response and operations. It will have a laboratory systems. It will have a risk assessment and planning. It will have risk communication. And then it will have a national legislation, policy, and financing to enable all parties effectively execute the preparedness plan Ghana needs in its legislation, policy, and financing in place to support overall preparedness for the prevention of epidemics. We will not go into the details of this. This is a whole day's or 3 or 4 day seminar. But this can be done, and I have to congratulate my colleagues at the University of Ghana School of Public Health. Over 10 years ago, it's now 15 years now, we started training the human workforce. Most of you have heard about Ghana Epidemiology and Laboratory Training Partnerships. They've trained, what is the cohort now? 15? 16 cohorts of people who have graduated with an MPhil and have not been posted anywhere to do their work. We have a workforce that will take off tomorrow if we create a CDC. They are ready to go. We had middle-level trainees and we have the frontliners. Please, let's do something about that. If we create a structure and a system, then we can talk about financing. And what I propose for financing is that we should have an emergency fund that must be separate from the CDC. Those who work in at the CDC are not the best you want to give your money to. They know how to spend the money, but they don't know how to generate it. So, unlike the NHIS, I think you should create an independent funding agency its main role is to raise money. For example, if I were chair of that funding body, and the minister doesn't put the money into our bank account after 30 days, those monies will start generating interest. Okay? So you must have somebody at the level of a former minister who will look his counterpart in the face and says, you want your work to go on well, you are killing my work. Simple. Because you are sitting on my money. The people should be able to grow the fund because there will never be enough funds and there will be investment. Our partners outside, when they see that this is the serious business we are trying to do, will put money in this fund. But they will never put money in this big basket you have called Ministry of, what do they call it even? There's some terminology for it. Nobody is going to put money in that place which is not accountable. Okay? And they will fund the CDC. So this fund will fund the CDC and its activities. Thank you.
Thank you, Professor Binka. I wouldn't want to add any more to this. He said it as it is. Most importantly, prepare for the next pandemic or Ebola. It's very important. Now, without wasting much time, it only tells us that we have work to do. He also says that there is a workforce that will take off. If we've carried the water to our knee level, let's come together and put it on our head. I don't want to waste much time. Organizers, we should have given him 45 minutes to speak, not 20 minutes. So cut down your lunch by 30 minutes. The last speaker, before we go on a coffee break, and our MC is patiently waiting to take over from me. The last speaker is going to talk about the policy frameworks and advocacy in public health emergencies. None other but a very important personality who is an economist and has done quite a lot of work. Is a deputy country director of Send Ghana. And I know for a fact that he's worked closely with nutritionists. Without wasting much time, Dr. Emmanuel Ayifa. Nice to meet you.
Thank you. Good morning, ladies and gentlemen. I would want to, on behalf of the management of my organization, Send Ghana, thank Uhas for making this possible. In fact, when Sen and Ghai, we started discussing this somewhere last year, we were thinking about the fact that we already have been discussing this within the civil society space. But Ghana is not just about civil society. And then you can also not prosecute the agenda very well without focusing on the academia. Because issues of public health, you need the evidence to actually talk to government if you are a good advocate. And that is why Ghai and Send, we decided that let us try and work together, of course, with Uhas to get this done. So we are very grateful, Vice Chancellor and the University Management, for this opportunity. Prof. Binka has set a very good stage, so I wouldn't talk so much about it. My work is simple, just advocacy, and that is what we want to do. I'm speaking on the public health, on the policy frameworks and advocacy as far as our call to establish the public health emergency fund is concerned. I'll look at some key policies out there, and we are looking at about 5. The first is our constitution as a country. The Constitution of Ghana obviously talks about the fact that we need to take care of the health and well-being of every Ghanaian. And then the health security policy of Ghana, which is currently under revision, is also one thing that we'll be looking at. And then our national health policy, and then the popular national action plan for health securities, which the Vice Chancellor made mention of, and Prof. Binka also spoke about it. And the last, but not the least, which for me as a development economics is very important, has to do with our national medium-term development framework, which also has a health component of it. So these are the general policy frameworks that I want to point out to quickly before we look at our call. Of course, I've mentioned the Constitution, what it clearly states. For the sake of time, I won't belabor the point, but I'm sure everybody here knows what the Constitution says about our well-being as a country. Page 6 of our national health policy, Madam Chair, if you enjoy me, I'll just read what it says. Say the policy seeks to strengthen surveillance and response systems to prevent, detect, investigate, protect against, control, and provide a public health response to the spread of diseases resulting from epidemics and disasters. The earlier two speakers have said so much about the need to be prepared in case of public health emergencies. And this, as clearly stated in our national health policy, also buttress the point. Our national health security, which is currently under revision, and indeed Ghana has been part of this process. That also speaks directly to the fact that it is important to look at epidemic preparedness, prevention, and the need to also respond quickly. And in fact, related to that has to do with what it specifically says about the National Action Plan for Health Security. The fact that, yes, the NAFs actually exist, but the health security policy clearly states that it is important that we have to look at legislation for health security that will go to strengthen our country's capacity as far as the issue of pandemic preparedness and response is concerned. The international health regulation, as was earlier highlighted by the Vice Chancellor and Prof. Binka, we sign on. We are always quick to be part of the very first when it comes to signing on to treaties and whatnot. As far back as 2005, that is what we signed to. And the good thing is that we did a good job to cost the NAFs, which every country is enjoined to prepare as far as you are a signatory to the IHR. The country costed the NAFs, but beyond the costing, funding became an issue. And so we've not been able to fund the NAFs so much. What you see is the cost. And incidentally, it's just this year that the very first NAF is supposed to end. If you look at it, we are looking at approximately $20 million for prevention, $44 million for detection, response is $24 million, and for other IHR hazards, approximately $9 million. So we are looking at close to $90 million costed, but it just remained costed. We do engage the Ministry of Finance and the Ministry of Health, of course, Ghana Health Service a lot, and this has been their headache. The last but not the least is the policy framework that actually drives our country's development agenda, be it health, education, and what have you. But our interest is health because we are speaking as public health persons this morning. And so if you look at our national medium-term development framework. In particular, the section 6.5.3 actually talks about biological threats. Section 6.5.3 talks about biological threats, which obviously looks at the issue of pandemic prevention, preparedness. Aside that, there are specific indicators even within the National Medium-Term Development Framework that actually speak specifically to epidemics and pandemics. And so that tells us that as a nation, we have the plan. What is left is the commitment to execute the plan. And the commitment is not there because the funding is actually not there. What I showed you earlier had to do with our current National Development Plan, which ends in 2025. But even the earlier one still actually had some provisions for the establishment of public health emergency fund. So that tells us that even before COVID, the country's development plan had that zeal to establish a public health emergency fund. But then the question is, how come that up till now, nothing has been done about it? So for us as Send Ghana and Global Health Advocacy Incubator, we think that it shouldn't just be a lip service. We shouldn't have such a nice policy document like the National Medium-Term Development Plan have specific statement in it suggesting that it's important for us to establish a public health emergency fund. However, it just remained a lip service for over 7 years now. At least if for nothing at all, the COVID-19 pandemic should tell us something that we need to get this done. The fact is that this is not only Ghana. I know WHO, as was highlighted by Prof. Binka, is enjoining all countries to establish such a fund. So there's Africa Public Health Emergency Fund that, as we know, Ghana has never contributed, at least as far as the record is there. Ghana, so far, we've never had any contribution to it. The list of countries you look at, before I came, my colleague Prof. Prelkon of UCC, she just showed me and wanted to even confirm whether I have the current figures. And I said that no, this is what we have been working on to get from the ministry, but so far we've not had anything like that. And so what are we calling for? The call is that as much as possible for Send Ghana and Global Health Advocacy Incubator, and of course now Uhas is our bedfellow. So we are calling that governments to, as a matter of priority, try to establish the Public Health Emergency Fund. The issue has to do with the fact that, one, when COVID hit us, we had to go into the contingency fund. We went out to borrow, and unfortunately, as Prof highlighted, there was no accountability and transparency to the usage of the fund. But we think that it is timely now to really commit to establishing such a fund. One may ask, of all these challenges with funding and considering the current challenge with the economy, how do we get the money to get it going? Maybe because there's no money, that is why government have not even contributed Ghana's bit as far as the African Public Health Emergency Fund is concerned. But what we are saying is that at least we have something to leverage on. The president, in his last Good Evening Ghana address, actually stated that now the job of the COVID-19 Trust Fund is done, and so by September or so, they are no longer going to be in operation. However, he indicated that although COVID is no more, as declared by WHO and the President himself, he indicated that the COVID-19 health levy, which enjoins everybody when you are purchasing any good or service to contribute 1% of that price to the COVID-19 health levy as a fund. That fund is not going to be disbanded. And I remember that there have been a lot of calls from citizens as to why we still need the COVID-19 health levy. Because you are telling me that there's no COVID. And if a fund was established, a levy was instituted solely for COVID-19, and there's no COVID-19, then it sounds that it's important. We need to actually take off the levy. And that has been the argument so far. The media and other people highlighting that. It's important to note that the COVID-19 health levy, since its establishment, at least have roped in some substantial amount of money. The first 3 months of its establishment, if you remember in 2021, we got some little money. It was around 360 or so million Ghana cedis. However, this year, we are projected to have 2.5 billion Ghana cedis from the COVID-19 health levy alone. And for 2025, we are projected to get around 5.6 billion. If such a levy is generating so much revenue, and unfortunately up to now, we don't have any sense of transparency and accountability in the usage of what has been collected so far. And still, the president is saying that we still need to keep such a fund. Then it's important for us to begin to ask questions and to say to such a president that you need to show us what that money should be used for. Other than that, of course, the clarion call is that it's not necessary. But for St. Ghana and for Ghai, what we are suggesting rather, that establish the Public Health Emergency Fund and let us convert the COVID-19 health levy into the Public Health Emergency Levy. Because once it's COVID-19 levy, it is just for COVID-19. We are saying that rather let's convert that into a Public Health Emergency Levy. And the money so far that we are projecting, 2.5 billion for this year, should be used as the seed money for the Public Health Emergency Fund. I believe that if the president should listen to us, I believe Ghanaians are not going to grumble in paying the COVID-19 health levy. And so that is our call, just looking at how much money we can get from this alone. And then the fact is that there are other means that we can get other funding. The World Bank has what is called the Pandemic Fund. But for you to be able to get money from the Pandemic Fund, you need to show what you have. And so establishing such a fund and then using the COVID-19 health levy, now we want to call it the Public Health Emergency Levy, which has to go to Parliament for approval. Once that is done, then we can leverage other funding, because we need to show that we have what we can start with. So far, these are the little advocacy that we've been able to do. At Sen and Ghai, we do what is called citizens' input into the budget. Every year, before the budget is ready, we go around the country to find out about people's expectations and what they propose to government. And so with that, citizens generally in 2022, when we were looking at the 2023 budget, because of the experience of COVID, actually suggested that it's important that you have a budget line specially dedicated for funding public health emergencies. So this proposal was sent to the Ministry of Finance, and then we also have sent petitions to the President, the Ministry of Finance, Ministry of Health and Parliament. This was a petition that was signed by around 500 citizens, which the President and the Ministry has. We've done some public health education to that effect in terms of educating or sensitizing Ghanaians about the need to establish such a fund. We also held a National Stakeholder Forum, which sought input from key actors. In fact, we had the academia there, especially from the Gucci, and then from School of Public Health, University of Ghana. We had the COVID-19 Health or Trust Fund Secretariat being there. We had a gamut of key stakeholders who were present. And in fact, the clarion call was that it's important we go to the President to actually present the document to him, of course, through the Ministry of Finance. I know that Prof. Vinka is suggesting that we shouldn't actually be dealing with the Ministry of Finance. He's right, based on the experiences. But then the fact is that they hold the public purse. So in as much as for us, we are also calling for total independence. We think that if such a fund is established, it should be an independent authority. So it should not be manned, of course, by the Ministry of Finance. But to get the processes kick in, we need the Ministry of Finance, we need the Ministry of Health, we need Parliament to get it started. However, once it's established, we want it to be independent, devoid of government influence. In fact, that is what all the stakeholders spoke about. For the interest of time, I won't go into the details. Maybe in the discussions, we'll talk about those details. And of course, today's symposium is also one of the advocacy strategies that we are using. And we are using this medium to call on the academia and all of us to rally around to support this call. We'll be having a meeting with the Interministerial Committee on Health. Prof. Binka asked about who are the members. When we have the meeting, we'll get to know who actually are the members. And then we'll be submitting the proposal to the Ministry of Finance. We have a very structured document. Of course, we'll be adding on some of these things that we are doing currently to that. In that proposal, we've set out the policy and legal framework. Then, of course, we'll talk about public health emergencies and its impact on our economy. And then we'll look at the proposed structure. The fact that we are calling for independence of the fund. I mean, it could be akin to the GET fund and then all the funds, but we don't want it to politicize like the way GET fund and the like are politicized. We think that even the administrator should not be appointed by the president. So all those submissions are going to be in what we're going to submit to the Ministry of Finance. And of course, we also will be contributing to the health security policy. So this is my last call. The call is that all of us here need to join the noise that we are making about the need to establish the Public Health Emergency Fund. The fact is that when any pandemic hit, like the case of the COVID, it affected all of us. And so we shouldn't see this call as a call of Sen Ghana and Ghai alone. The academia is very, very relevant in this call. As I said, for us, we do what is called evidence-informed advocacy. And with the evidence, we need the academia on board. And we believe that with a strong political will, this can happen. Thank you.
Thank you so much, Dr. Ifa. Without wasting much time, we're going to go into the next session, which will be coffee break. I'm glad to say. But before the coffee break, we are going to all converge outside and take a group photo. You need to be captured. But I want to acknowledge our online participants who are on Zoom, on YouTube, on Facebook platforms. You've done very well. And we appreciate your patience. We request that you fill in the online registration form from the Zoom live chat. If you have any questions, any comments, any concerns, we encourage you to put that online. We also want to acknowledge the University of Ghana who are here, KNUST, you are here, University of Energy, you are here, University of Uhas is here, and UCC, you are here. WHO is here, USAID, the media, the Ghana News Agency, broadcast media, you are here, and any other, and all of you, you are very much welcome to today's important meeting. So I would stop here and then invite you all to go outside and then we'll take a group picture. That is very important. So those online, please be patient with us whilst we have the group picture and the coffee break. You can break and have some coffee and come back. And then after 30 minutes, we'll have. We enter into a very important session. Please don't go away. And we have Gregory Amenuvegbe and Professor Kofi Nyako who will take over. Thank you. Please, let's go outside quickly and have the photograph. After the photograph, you can have your charts and shake hands. Photograph, 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 please. Hello, hello, hello. Please, let's reconvene. We gave you 15 minutes, but it looks like we've exceeded that time. There's so much to talk about. Please, I'm sorry to intrude, but those on online are waiting. Please, we need you here. Let's reconvene. Those outside, Dr. Joyce there. Please, can you bring your people in? Greg, are you ready? Professor Kofi Nyako, Akwaba.
Hello, hello. As you reconvene, I have a couple of announcements. First of all, I want to acknowledge everyone who's joined us on Zoom, those who were there from the beginning, as well as anyone else who has come on board more recently. We also have people watching on YouTube and Facebook, and we thank you for your presence. We see you, we acknowledge you. For those on Zoom, there is a registration form that has been posted in the chat section. So just click on the chat. There's a registration form there. Please fill it so that we know that you took part in this and then you're duly acknowledged. Also, post any comments, questions, or contributions that you have to this symposium online using the chat function, and we will retrieve those and share during the open forum. With that, we are back in session. Thank you for coming back hastily. I hope you're enjoying the lovely meat pie and fantastic beverages that are provided there for you. We have the panelists are going to come on board, but to do so, I want to invite the two moderators. We have Professor Kofi Mensah-Nyarko, who's the acting dean of the School of Natural and Environmental Sciences at UESD, a renowned public health practitioner and medical doctor. He is going to lead the moderation session, and he is going to be very ably assisted by Mr. Gregory Amenuvegbe of our own Fred Newton Binker School of Public Health here at Uhas. Gentlemen, you're welcome. Okay. Yes, give it up for them. Okay, so I'll hand over to Professor Nyarko now, and he will take over from here.
Thank you very much. So we're going to the next session on the round table. So we will invite our panelists to join us here. We have the first person from St. Ghana, Dr. Emmanuel Aifa. We have Dr. Wisdom Atiotu from the Ministry of Health. Dr. Donne Ameme from the Ghana Field Epidemiology and Laboratory Training Program, Africa Field Epidemiology Network, AFINET. Dr. Kingsley Preko from UCC. And Dr. Rachel Mills from UCC. Dr. Stephen Apanga from UDS. Oforiwa Potofi from Ghana Health Service, Health Promotion. Professor Idani UDS. Dr. Yete Enuame SPHK NUST. And Dr. John Tenge, Field Epidemiology and Laboratory Network of Ghana, the President. And last but not the least, representative from the World Health Organization, Ghana Country Office, in the person of Dr. Guracha. Yes. Okay, you can pull it and make it long. Wisdom. Yeah, it's a very big round table. Wisdom. I hope everyone is fine. Okay, thank you very much. So this discussion on the public health emergency preparedness, response, and funding on the role of institutions in addressing these challenges. And we've had the speakers talk about public health emergency funds, the importance. So we have just a and with the number, I think we will all be brief. But to start with, we know that yes, we know that outbreaks, they are inevitable. Pandemics will always be with us. Over the years, globally, we've had pandemics, the plague, we had the Spanish flu, right now the COVID, cholera, meningitis. In Jon Snow's time, there was a huge outbreak in Europe. And so it will continue to be with us. And because of these emerging and re-emerging infectious diseases, whether we like it or not, we have, and one of the key limiting factors is the funding, the resources to do it. When there is a pandemic, something happens usually at the front. It can be in a Tebubu. So I will start from the Ministry of Health. Where do we get the money? Where do we get the funds? How do you get the people to get to the ground? Do you have some money at the Ministry of Health that when there is an emergency in Atebubu, the district director will call the ministry and you send them money to respond? Because early detection saves life. We have to respond early, else it becomes a disaster. So I'll hand over the mic to Dr. Wisdom Atiotu, my colleague, who is now director, a big position at the ministry, representing the minister today. Over to you, Dr. Atiotu.
Thank you very much, Professor Yanko, my colleague and roommate, actually. Response to any public health emergency is an integral part of the health system as we have it now, with its all of its faults. Let me say that there are some resources available, both and that includes financial, human resource, and some structural arrangements in place for us to respond to public health emergencies. Using the case of COVID, for instance, I think you all agree that even for the advanced countries, COVID response was a different ballgame altogether. There are some things we did correctly. There are a few things we didn't do well. But if within the same space of COVID, realize that the ministry was able to mobilize resources within a very short time, both local and then international. And local, we are looking at government direct allocation. We're also looking at the laws that were made to gather more money for the response, and then the development partners' contribution through the World Bank projects that made money available for the response. But within the health system are programs and structures that enables us to respond to emergencies. And that includes quickly mobilizing resources from various angles to support this. Thank you.
Just a follow-up. Since we know that preparedness is very key, you've talked about what happens when there is an alert or you have to go to the field. So now, is there any fund available at the ministry to help in preparedness, and where there's any collaborations of academia to ensure that the country is prepared at any time these emergencies happen? Because what you described is clear, that when it happens, you describe the response clearly. Is there anything on preparedness? Since we think that preparedness should be the key in public health emergencies response.
So during Prof. Binker's presentation, he mentioned about 2 or 3 sources of secured funding by legislation. There's the NHIS fund, there's the COVID response levy, then there was also the COVID response fund that was led by the former Chief Justice. These are structures, available resources, though not committed to pandemic response. Ministry is able to mobilize some of these to respond to pandemics. And if you look at the current, the last issue of vaccines, for instance, NHIA had to come in with the funds to support the purchase of vaccines and all that. So there are various arrangements. The challenge has been the fact that it is not all this money which are under the direct control of the Ministry of Health. But the ability of the ministry to mobilize these resources, there's no doubt that works. Yeah.
Thank you very much, Dr. Wisdom Atioto. From you, I'll go to our rep from WHO. And if you can get a mic for him. Because you are a World Health Organization, based on your global expertise and your experiences, can you give us some examples of successful examples from other countries where they have these funds and they've effectively been able to mobilize and get this running for preparedness and response, having a dedicated fund? Is there any globally, and if so, also Africa, so that you can share with us? Thank you.
Yes, for the question. Take you back to the IHR 2005, which is a legally binding document we had in the morning. But also, it is also an obligation. State parties are obliged to develop and maintain minimum IHR core capacity. That's one thing about the IHR. Secondly, the state parties are also obliged to make annual reports on how far they are with the developing of the core capacities in the country. In 2017, Ghana conducted what we call joint external evaluation to look at all the about 16 minimum core capacities to make a country prepared for outbreak. And it is on the basis of that National Action Plan of Health Security, which is costed, which was developed and which was also mentioned here in the this morning. Now, in WHO, we look at countries mobilizing resources both internally and also from partners to align themselves to what the country has found out to be the gaps in the National Action Plan for Health Securities. Now, for currently, what was also mentioned this morning was an intermediary fund, global intermediary fund with what we call the pandemic fund. Globally, what WHO is looking at and partners looking at is how do we provide catalytic fund for national health security for the plan, National Action Plan for Health Security. Just to have that bare minimum strengthening of the preparedness in a country. And the first call for proposal has just been completed, and Ghana participated in it. And globally, what was available was about $300 million for the first call, $300 million for the first call for all the countries. So you can imagine how meager that resources is and how it is important for the domestic funds to kick in actually. So this pandemic fund is for catalytic kind of input for countries. So I think for me, apart from giving an example for other countries, I want to look at it that where we are and that we are heading to the right direction. We need to make sure that resources are mobilized locally, and where we have additional funds from global funding mechanisms. Thank you.
Thank you.
What the WHO rep said in terms of possible best practices out there, because for Sen and Ghai, we believe that we should also point to government what exists elsewhere to, of course, inform us. I'm giving just two examples. One is in the US, another very close to us in Africa. So the US government established such a fund. Initially, they voted in 5 billion cedis. I think it was through what they call the Rosa Bill. It was one of the parliamentarians. In a Ghanaian context, you say parliamentarians actually proposed that. The fact that it's important. I think that was during the Ebola case. The fact is that they realized that, of course, Ebola was now in the US, but it's important that the US become prepared. And so that amount of money was voted. Very close to us, our big brother, Nigeria. It's a very good case to cite that they have kickstarted something like that. And there's some research that has shown that that has actually even reduced in terms of the rate at which they respond. I think about 128%, if I'm not mistaken. And so there are some good cases that at least are coming up. But of course, the last has to do with the WHO own African Pandemic Fund. That is there. It's also to point to. Thank you.
Thank you very much, Doc. So my next question is to academia, and I will ask about 3 institutions to answer the same question. We will start with Dr. Yete Nwema from KNUST. If you can get a mic to him. How can the academic institutions collaborate with each other to present a comprehensive and compelling case so that government will be able to establish what we are looking at? So what should be the role of academia in this, since we know that we don't have a dedicated public health emergency fund, even though we have some things that help us to do what we are doing. So over to you, Doc.
Thank you. Thank you very much for the question. Looking at the way academia works, I think bringing us together as a group to actually put together our needs and articulate it better would actually be a strong fund for whatever we actually bring up. So far, we've been working in our independent blocks, pushing our individual agendas based on our institutional, I'll call it, objectives and all that. But looking at what is ahead of us and looking at the need for us to actually work as a bigger team to push forward an agenda which will benefit us all, our collaborations, our discussions as a group would be very, very fruitful. That's the list I'll start with for now. Thank you.
Yes, Tidani.
Thank you. Okay. As my colleague rightly put it, I think in recent times, collaboration is the way to go. If you collaborate, you will be able to drive the agenda that you have. So bringing all of us together to reflect on this very important issue, I think will help in driving the agenda that will end up preparing the progress of this public health emergency fund that we are so interested in. So the collaboration will help a lot. Yeah, thank you.
Much. Dr. Kingsley Preku from UCC. What steps do you think academic institutions should take to ensure that the training programs aligns with the needs in terms of emergency preparedness and response? Because if you have the funds and the capacity building is also not done right, you have the. So after that, you can hand over the mic to Dr. Rachel Mills to continue on the same question. Thank you.
So if we have to look at the university and its input in all this, one, I look at it in what we do best as a university, which has to do with training. I know some institutions already have started some training programs on disaster preparedness and all that, which we can leverage on to actually strengthen the capacities that we need in looking at this issue of funding health emergencies very critically. I know discussions have been so far on issues of health financing and all that, and it's all borders to the various technical capacities that we have. The key thing also has been the key persons within academia who had actually fronted many technical groups who have been chairs of various technical groups that drives some of these initiatives in some advanced countries, as we know, the chair of health and all that, where key technical persons with the expertise are highly engaged and not who matter as far as politics is concerned. So I think universities have the right expertise to put at the leverage of this fund. And then most importantly also our development of research towards the areas of fund growth and fund development as far as this is concerned.
Okay, so to add to what my colleague just said, I believe that universities are well positioned to harmonize the curricula so that when it comes to training, the training will be standardized across the various institutions. So people who are trained from Uhas or from UCC will be well equipped in terms of preparedness. But what we would also want to advocate for is the support for funding for this training. Because when it comes to research, equipping students with research, we need a lot of money, we need labs to be built. So we would hope that setting apart such a fund, then research institutions can benefit. So that in the case of KCCR, where they were able to come up with a new kit, universities can go ahead and also support the development of such new diagnostics. So I believe that it is very crucial that academia comes on board to support the preparedness and response of epidemics. Thank you.
Okay, thank you very much, Dr. Rachel Mills. Next question is Ghana Health Service. How to Oforiwa Potofi?
Yes.
How do you think Ghana Health Service can work collaboratively with the academic institutions, since we have a lot of them here, to advocate for the establishment of a dedicated fund for public health emergency preparedness and response? That's the first part. Then after that, you tell us how you think for human resource, how can we facilitate the integration of these institutions' expertise and resources to get to the resources that we need? Because in emergency preparedness and response, we need various expertise. Remember during the COVID, we had various thematic areas. So we have different areas of expertise that work together in preparedness and response. Thank you.
Okay, so the position of the Ghana Health Service when it comes to emergency preparedness is to leverage on collaboration with our international partners, because we have built trust and confidence over the years. So the direction right now is to get grants to support academic institutions to help in their research, to monitor and evaluate this fund once it's been instituted. Because as much as we are interested in getting funds, how do we make sure that there's accountability to ensure that there's sustainability? So that is the focus of the Ghana Health Service. And your second question, you were talking about
the various expertise, human resource.
Yes, so we are going to leverage on them and with technology to train everybody involved. Currently, there has been the establishment of our emergency centers, one which was established in Ho, and all the HR involved are being trained as such.
Okay, thank you. We have with us the Africa Field Epidemiology Network, which has supports capacity building and other things on the continent, and their regional technical coordinator is here with us, Dr. Ameme, who is also with the Ghana Field Epidemiology Laboratory Training Program. How do you think AFINET or FETP training can contribute to the development of the implementation of this emergency fund in any other related staff with academia.
Okay, so thank you very much. So as you rightly mentioned, the food epidemiology training program is already contributing in a way. What I think we can do in addition is collaboration, as my colleagues have mentioned, but there's a need for us to be able to generate or support in generating data to support the advocacy that we want for the establishment. Because if you ask those who are in the lead that you want an establishment of a fund, the question is, why do we need that? So there must be some data to support that advocacy, which, because we are on the field and we also are integrated into the academic institution and also collaborate with the Ghana Health Service, we are in a better position to help generate that data. The question has always been why? And if before there was no such funding for epidemics, but the narrative has been the country has done very well in most of the outbreaks that we've managed. So it will be in our place to support a certain agenda, to generate evidence, to be able to convince those who are in the leadership to be able to see the need for creating such a funding. But that's also to say that we also need to consider other aspects if this funding mechanisms are established, which has been said already by Prof. Binka, so I wouldn't want to belabor that point.
Okay, if you can give it to Dr. John Tinge, since he is the president of the Field Epidemiology Network. As Prof. Binka said, over 15 years ago, Ghana started training field epidemiologists throughout the country in collaboration with the University of Ghana and the Ghana Health Service and the Ministry of Health. And now we have a lot of field epidemiologists at various levels, 2-year MPhil program, 1-year intermediate, 3-month frontline, and they supported the COVID response, and they were very deep in it. So, and he's the president of this network. So how do you think this network and the work that you do can link with this emergency funds that we are talking about? Over to you, Dr. Tinge.
So as you said, we were actually called upon during the COVID time, and we were posted to the centers in the regions, in the districts as the field epidemiologists, and we helped to get the data, the GPS of the contacts, and then the cases. But what we also realized was the school, that the GFELT was the main focus for our calling into to be part of the investigation. So they also have to look for their own funds to support us. So now what we are looking at is how do we get direct access to the ministry? As Prof. Binka said, now we have trained advanced level above 150, but none of us has been officially posted. Some of us have really found our way in various institutions and fields. We are doing our best. Recently, there was an outbreak, a food poison outbreak in Oyarifa. They did their initial assessment, and some of us went to do the investigation, and it's like the district has no money to support us coming to assist them with what was going on. And in the end, we had a training, and they were asking whether we are coming with some funds. And we said, no, we don't have any funds. So what do we do now? So that is the issue about creating this fund to support some of these investigations. As I want to also add that currently the school is not only based on epidemics. As we now know that health security also involves disaster. We have also a model that is called the chemical exposure or chemical preparedness, where it has been part of our training, like the Apiate incidents. Most of our members went to investigate. Now we have another issue like the mining that is really coming out. It's another epidemic that's on our hand. And at the peak of the epidemic referring to COVID, there was an argument about within a 2-year period, COVID has claimed about 100,050 lives. But just a 6-month period to 9 months, road traffic injuries has claimed more than 2,000 people. So we are asking, where was our priority? But because there are different sort of exposure, our attention was more on COVID. So my point now is, how do we leverage on this expertise? We're talking about using our expertise, as the question was asked to the Ghana Health Service rep. We have the expertise in Ghana. During the COVID time that I got to know that indeed Ghanaians, we are rich with expertise, but how to bring them on board, how to collaborate. And I must say that some of these things also, when it happens, there's a lot of politics that goes on. The person that really qualifies to lead the team, he is tagged, so he's not consulted. And in the end, he also sits back to look at what is going on. So for us, we are saying that we have the expertise. We know our training is based on the One Health concept. So we have the medics, we have the veterinarians, we have the environmental specialists, and we have the laboratorians, all under One Health concept. So we are set, ever ready to respond to any emergencies that come. But who to coordinate us? If our institution doesn't come to us, the Ghana Health Service that trained us doesn't, quote unquote, really even know where we are now. So that's the problem that we are having. So let me also go back to what Prof. Binka said. Is it going to be a body, apart from the Ghana Health Service, that's going to take charge of this fund and allocate or look at the expertise and call them to respond? So for us, we are ever ready to assist. I also want to make this appeal that we are dotted all over the region and that we are ever ready when there's an outbreak that you need.
Okay, thank you very much, Dr. John. Thank you for this elaborate. Now I will go to Dr. Stephen Apanga, who is a field epidemiologist who trained from the School of Public Health, University of Ghana, but is now of UDS. So he's wearing two hats, field epidemiologist and also sitting at UDS Medical School, I think. So from all that you have said, how do you think these academic institutions will be able to ensure effective translation of the research and also the knowledge gained in the field? Because when you were in field epidemiology, we went to the field, we do outbreaks, we do a lot of things. How do you translate this information and research to help in this emergency response and also help make a case for these emergency funds? Over to you, Dr. Apanga.
Thank you very much, Prof, for the question. As academicians, we have 3 core duties or responsibilities. First is to teach or train. Second is to conduct research. And the third is to offer or render community services. So if you look at this triad, we need to leverage some kind of funding to be able to meet these core duties. And what is important is to look at how we are able to help organize quality data. That is what we lack. Somewhere 2018, I was involved in training frontline primary health workers, healthcare workers, to see how they can reorient whatever data they collect and how they can use that for effective planning. You cannot be prepared if you don't plan. So what we went through was to let them know that they had everything they needed, but how to organize it and use it. was what was lacking. So they were just generating the data, transmitting the data to the sub-districts or the district level for DIMS, and that was all. That was all that they were doing. So after having some training sessions with them, and that is where we come in as academic institutions again. That turned out to be a very good model that they were so happy, and they thought that there was no need for us to organize big-time workshops, bring them to nice hotels, and say we are going to train them on data management. So we opened their books, we sat down with them, we organized the data, they saw where the gaps were, and they saw the need to fill in those gaps. So that is very key. And at the end of the day, if you carry out research and you don't get the support to implement whatever wonderful ideas that you have come out with, then what is the use? And this is where the focus will have to be. And once we get the funding for this, together with the Ministry of Health, the Ghana Health Service, we can assist in the implementation, and that will constitute our community service component of our core duties. Thank you.
Thank you very much. Now, Dr. Emmanuel Ayufa, how can you, from civil society, work with academia to get this, our vision on board? Because academic institutions, they teach, they do research, they do community service. But some of them, telling them to go to parliament, do advocacy, it's not part of what they do all the time. But now you need academia to get this done. So how do we come in?
Thank you. I made a point earlier is that for SEND and Ghai, we do evidence-informed advocacy. And considering that the academia, what you know best is to put out the evidence through research. Sometimes, of course, most of your focus is let me publish and get acknowledged or promotion. But once you do that, we would also, of course, will focus on trying to distill in the policy information from there, of course, to use for the advocacy. So I believe that we can work together. Aside that, yes, I know you don't have time to be going to the parliament to engage, but I all know that in most instances, some of our media persons speak to the academia. You have the chance to be on boards. You have the chance to be invited to speak to certain issues nationally. And I'm very sure that government will listen. There have been times that we've met with the president. I remember there was the last time in November or so. And the president said, you think we do not read. We read the sort of things that some of you CSOs write and some of the things that come from the academia. So I believe that, yes, we can work together closely. Let me say that, when COVID hit, it was purely, we're all looking up to Noguchi and KCCR. These are prominent academic institutions that we looked up to. I myself also read some articles from some people from Public Health, University of Ghana, looking at the social dimensions of it. And so I believe that there's a lot of collaboration that we can. In fact, our proposal to government, in there, I didn't talk so much about it because of time when I was presenting. But as part of the key people to benefit, academia is one. And we've outlined the reasons why, if such a fund is established, it's important to support our academic institutions. I mean, talk about all the brains that we have here, even including the Ghana Field Epidemiology training program. I mean, all these ones are critical. Once I have the mic, if I can just touch on something briefly about the call from Ghana Health Service and the fact that we'll be looking at getting our external guys to support. You see, we are where we are as a country because we always want to depend on the external donors. It is not wrong to do that, but lessons even from COVID should tell us. Because when COVID hit us, we were all looking out to get some windfall gain from the World Bank and WHO and IMF and whatnot. If we had a fund established, I believe that would have been the very first place to look at. So yes, Ghana Health Service, you might want to look at the grants from the external sources. As concessional as those loans or grants may be, will end up paying. And so we think that it's important for us to look within first. WHO just told us about the fact that the pandemic fund is to support all countries. However, the necessary condition is that countries need to show some level of commitment. So I believe that that is the way to go. Thank you.
Thank you. I think Mr. Craig has a critical question to ask at the lower level, which boils down to local government. So can we give him the mic? Then we can get maybe 2 people to answer that. Then we will come to the concluding session. Thank you.
Yeah, thank you. Looking at epidemics, mostly it's weak at the local, when we have localized epidemics occurring in districts. By the time we reach there, they are weak in funding. And here we are, we're talking of how this public health emergency will secure fund. And I know when we do that, then the localized epidemics will be resourced as quickly as possible to avert a lot before maybe things get out of hand. Here is the case. If you look at the art that Prof was showing, you will see that if you read that art, DCE, as a head of the DISEC, they declare outbreak at that level. They have power to declare the outbreak, but when you go for funding, then they are not supporting that authority with the funding. We also know that 1% malaria, 1% global fund, HIV and TB is always lodged with them in terms of common fund. So as we are looking for public health emergency fund, what can we do to start something from the local, all the assemblies, so that when there is local level outbreak, this group will be able to resource them as quickly as possible. Thank you.
Okay. No, you can go first.
Okay. Well, this is a very important thing, and we go back to COVID. We realize that much of the mobilization started here with us. And we're always talking about industries. The moment the president called on the establishment of the public health fund, the COVID fund, you saw industries pulling in and other institutions helping with their little resources. It tells us that we all care about emergencies, and we can do that. What it is needed for me is that, yes, we have fine acts and whatnot. Usually, the missing link lies with the implementation part of it. Can we have a clear monitoring system to ensure that these acts have really been developed into more of actionable plans and key monitoring indicators and persons assigned to monitor how these are implemented? Other than that, we'll continue to have funds lodging in certain places and be misplaced, be misappropriated, or whatever it is. So I think that the key thing is that let's develop much more of our policies into actionable words and keep a key monitoring part on it. Another key important persons were asking how SEN can collaborate with us is the civil society groups that are around. How do we empower them to demand for the change, to watch the process? That is where sometimes it is lacking. We have most of our civil society groups now turning, who are supposed to be advocates and who are supposed to be watchers, now turning into program implementers and all that. But the key thing has to lie with that. we need to empower these groups. And for me, academia is very strong in that because I've been working a lot with certain civil societies in some of these trainings and all that. We need to empower our people to demand for the change that is necessary. And I believe politicians listen when a lot of people are talking. And we need to get that information out there and follow the process.
Thank you. Yeah, I think it's an important question because normally we look to the higher level, the national level, and then forget about the grassroots. And it played out during 2020, 2021, during the COVID. Of course, districts were looking up to the national level for. And so for us, one other proposition is for us to look at the District Assembly Common Fund. As far as it's not common, because of the delays and challenges with its disbursement. The point is that in policy practice, once it's specific, it becomes specific, there's a line to say that as much as possible, there should be this particular allocation tailored to take care of public health emergencies. I believe that notwithstanding that it delays, when it comes, there will be that one solely for. So that is one thing that we are suggesting. Another has to do with IGFs. We are also suggesting that there should be IGF combo, and that one is even at the hospital level, the facility, district facility level. I know that it's also quite difficult, but if you are intentional about public health emergencies, and there's also a dedicated sort of money solely for that in a separate account. I don't know how that operation could be, but we are envisioning something like that. That would also support the national one. That doesn't mean that the proposed fund is to sit in Accra just to look at only national level operations. Of course, the idea is that the bigger fund we are calling for should trickle down to the district. But, you know, sometimes in terms of the lag between the time that there's a pandemic and when you need to transfer the money nationally, the red tapeism in our system may cause very huge delays. However, if you have such district level allocations already there, that would help. And the last had to do with having guidelines from the Ministry of Finance. That's why we need to work with them. Because districts also they have their budget, aside the national budget. So if there's specific guidelines for district to follow, that particular line has to be for health, I think that will help. So that is just to contribute to your.
Okay.
Mine is just an addition to what my colleagues have actually said over more of the generation. Our focus so far in the discussions have seemed to be tailored more towards our tax persuades that government collects and pulling them into all these funds and all that. But there is also that whole, if we keep looking at the West as best practice and all that, there are foundations out there who are willing to support. There are individuals out there who've got resources which could be pulled to support such agenda. And there are several of them around. Are we as transparent as possible for them to see what the little that others have contributed are being used for? And on that basis, people will feel free to also put in their best to support such a cause. I would think these issues that came up earlier on transparency would have to be seriously addressed. Because if I've put in something and I'm not seeing its, its benefit to anybody, so much is pulled to the central point, we still don't see what gets done with that at the bottom of the ladder. It does not actually encourage that level of, even given all the taxes, even will also even be a problem out there. So let there be transparency. Of course, academia will generate its evidence, bring all that out. But if there is no transparency as to how these resources are used, we might be losing a real great opportunity, mobilizing more resources from those diverse people who would actually have will to support such a process. That's the little I want to add. Thank you.
Okay, so Greg, I think the question you asked is very important because the outbreaks or epidemics we are talking about will start from the local level. Now here is the big fund sitting at the top. But there's a suggestion that we can make it available readily also at the local level. But the question is the structures at the local level, to what extent are they functioning to be able to draw on this funding, even if it is available? That is the question we need to be asking. Because we make the argument about all this, the processes to be able to get it to the local level. But the issue is, what mechanisms are in place even for us to be able to get the funding to the local level? We talk about the guidelines. We discussed in the morning, and the discussions in the morning showed clearly that even in the presence of guidelines, they are not obeyed. So it tells me that for us to, whilst advocating for this fund, our arguments must be very, very robust, plugging all the loopholes, telling whoever is going to be in the lead of establishing these funds that we have been able to look around to plug all the loopholes. Otherwise, it becomes another fund which is going to be mismanaged. So I think that generating evidence around what is existing now and is not working, how can it work better, will be able to help us to support the advocacy that we are embarking on.
Okay, thank you very much. I think from that, I'll still go to Dr. Done. If you can give us some points on, in your view, since you've been in outbreak response and pandemic response at all levels, most of your career, currently we need these dedicated funds for preparedness and response. What do you think are the key gaps and challenges? That's the reason why we need this, that this money, when it's available, it will address. Can you tell us currently the challenges or the gaps and the reason why we are fighting for this funds?
Okay, so first of all, it's about the preparedness. So in the preparedness, I'll talk about training, which is what we do as a field epidemiology training program. So this training I mentioned earlier on is a collaboration between the university, the Ghana Health Service, and other partners. So the idea is to get competent workforce that are developed as part of the preparedness process. But it's not enough to have the program in existence if there is no funding to support the program. And like maybe you may know already, it is a program that is a competency-based training program, which means that the resources, financial resources that must go into training one individual are quite enormous, which means that governments should be willing to be able to dedicate some support or a line or budget line for training of field epidemiologists as a country. I should say that for all the 16 cohorts that we talk about at the advanced level, and then also for all the cohorts in the intermediate and all the cohorts in the frontline level, funding has been external. But maybe if we have a fund like this and it is well managed, we may be able to get some support to train, if not all, at least one or two field epidemiologists at these levels every year. So I think that one of the gaps is about the allocation of a budget line for training, which is an important aspect of the preparedness for epidemics. Then another one I can talk about is when outbreaks occur. My colleague has mentioned that they go to the districts and the districts don't have the necessary funding to be able to respond to the outbreaks. So it means that when outbreaks occur, it becomes a learning point for those who are in training, but also service delivery for the districts as well. Well, why is the funding to be able to respond to these outbreaks? Which means that when we have a fund and it is administered properly, it is at the local level, it can easily be assessed. Then we'll be able to respond to the outbreak. So these are the two that I can think of immediately.
Okay, thank you. Any other person to talk about the gaps? Yes, Uforiwa.
So, in the just ended health summit, we're talking about how funds can trickle down. And one of the points of advocacy was, like Prof was showing us on the slides, only 6% of the NHIL goes to the NHIA, which is one of the biggest ways of funding the Ghana Health Service currently. So how do we get the money to come down to the level where it's needed? And it was propagated that, why did we not advocate every parliament that is unable to get the funds, because according to the law, it's supposed to get to the authority in 30 days. So after 30 days, can 1/4 of parliament, where that can be just minority, say that then the Minister of Finance should be excused so that somebody else can get? Once it has been published as a law, then whoever is Minister of Finance is forced to get the money where it's supposed to be. So that's what we are advocating now. Can we get the funds sent to where it is now with what we currently have? And then instead of going to generate another fund, that will also still end up at the finance ministry. Thank you.
Okay, thank you. John, thank you. Can you move the, yeah.
Another gap that I also notice on when there's an outbreak is the collaboration between the government agencies. Because I'm a field person, I always use that example. The recent outbreak that happened, we investigated, we saw that the food vendor has a certificate to sell, but it was expired. So the environmental health issue were supposed to work on it, and then the director of health services was supposed to get an information from them. They said, no, we can't give you that information. FDA came to take a sample. Unfortunately, the sample from the Ghana Health Service got messed up. They didn't have any sample to test. FDA had the sample, they had the results. They said, I will not give you the result, but you give me the report that you have written. So the collaboration there is a very big challenge. So if we are looking for a fund, that all this gap has to be addressed before we set out the fund, and we know that indeed at the end, these funds, we know where it's going for, and we can appropriately account for it. Accounting for a fund is not only telling me that A or B received this, but what was it supposed to do, and did we get the end results of what it was supposed to do? Thank you.
Okay, can you send the mic to the WHO rep at the far right?
Yeah, so while we are discussing about the gaps, I would just like to bring to your attention that the IHR 2005 core capacities has many areas to look at. Actually, it's not just about outbreak, and it's not just about the response teams. These are 2 or 3 capacities that we are looking at. That is the human resource, and so on. But we need to look at, in the context of this pandemic emergency fund, we need to look at strengthening our laboratories, for example. We will need to look at health emergency management cycle, even health service provision to those communities when there is an outbreak, infection prevention and control in the health facilities, for example, risk communication and community engagement, and so on. So really, zoonotic diseases, food safety, chemical events, radiation events, and so on. So really, this fund can cover all that. So while we're looking at the gaps, let's widen our scope in the framework of IHR 2005.
Okay, Rachel, Dr. Mills.
Thank you very much. Please, one gap that I have also identified in academia is how academicians can simplify the research that we have generated for the general public to be able to consume it. Because most of the time, our research are published in Nature and very high, sophisticated scientific journals. And then sometimes it's very difficult for the average Ghanaian to understand these jargons that we put there. So one way we can try to bridge this gap to support our advocacy is to try to publish in our local papers. And I think some media organizations like the UCC campus, ATLFM does, is to bring on board researchers to tell about their findings in plain language to help the community members, because most times we conduct the research in the community and then we go and publish it outside. But now what we can do is to bring our results to the people, and then they can also then support, or they can also tag onto these CSOs who can leverage on it and then push forward the advocacy. Thank you.
Okay. Prof, can the mic go to Prof?
Yeah, thank you. To add to what my colleague indicated, well, the research is there, but the important thing is, what do we do with the research? And then most of the institutions, students go to the field. Is it possible to channel these findings through the students to do the advocacy? Because UDS, for instance, we have 3 trimesters, 1, 2, 3. The 3rd trimester, they go to the community. And that is where the advocacy, because they provide community service. So most of the time, we can do these things through the students. The other point is training, providing regular training to the service providers. We spoke a lot about health education and promotion. Those who do the surveillance at the district health directorate level, we can regularly provide training to these individuals to let them know, because they go to their communities all the time. They go on outreaches, and if you channel the findings through them, I think it will help a lot. And the 3rd gap is a rebranding of NADMO. We have it from the top up to bottom. How do we resource them? We only feel their presence anytime at all there is a disaster. If there's no disaster, you don't know they exist. Can we add additional responsibility? Instead of just coming in to provide mattresses, cabs, and food, can they also do the preventive messaging? Say that, at least, when you want something to be done, you know who to go to. And they also play a key role in the coordination. Because if one organization is not willing to work with another organization, if we rebrand NADMO, I think they will play that coordination role, and then I think it will help us in getting a resolution to these problems that we encounter.
Okay, thank you. So my last question to conclude, we will go to the ministry rep, the Director for Research, Statistics, and Information Management Directorate of the ministry. So can you, based on what we've said, what specific steps can the ministry take to ensure that the establishment of this dedicated fund for public health emergency will receive strong support from the government and it will be integrated into the national healthcare agenda? From where you sit, what can we do to get it done?
Thank you very much, Professor Nyako. I think, let me just step back a little. From the earlier discussions, it looks as the ministry's response to the previous pandemic was not properly organized. But I want to say that there was a very elaborate
that was rolled out. A lot of things were done. In terms of policies for the pandemic and the life after the pandemic, we are looking at the public health emergency policy. We're also looking at the Vaccine Institute. There were a lot of infrastructure development, new facilities. A lot of hospitals, for instance, increased their laboratory capacity. There was oxygen generation, a lot of the hospitals that didn't have. There were a lot of training. Again, there were funds established for the purpose of the pandemic. But the discussion so far is talking about a new fund. The question is, do we need a new fund, or do we improve the funds that we already have in place? Where evidence will be key. And this is also an area where universities, academia, and co can come in. The key question we need to first ask is, do we have the need for a new fund? We need evidence for that. And once we establish the evidence for the establishment for a new fund, we can start the processes. And that's what we have the capacity to do, processes to set up a new fund and ensuring that the correct things are done. So the critical issue for us is that, is there evidence for a new fund? Looking at what we have in place, looking at what was done during the pandemic, looking at even the strategies that the ministry is rolling out in terms of the health sector medium-term plan and all that. Once that need is established, why not? Evidence is the game, the name of the game. We can proceed from there. Thank you very much, Prof.
Okay, we are almost there, but Dr. Emmanuel wants to briefly just say a sentence, not a paragraph.
Thank you. I'll say yes, we need a new fund. The evidence is out there. Let me give certain instances. If for nothing at all, let's still go back to 2020. There was virtually nothing. We've done some work that the Ministry of Finance has been aware. We look at the sources of the funds. We went to the contingency fund. Okay. And most of the other funding sources came from the usual suspects. And these are monies that actually we are paying for. It contributes to part of the debt burden that all of us are grappling with. I mean, that is one. That is the second point. The third point is, if you even look at the Ministry of Health budgets, we are doing way below the Abuja declaration of 15%. It's just hovering around. These are also evidence. Around about 8.5 or so thereabout. And it's also heavy on personal emolument, paying for salaries and whatnot. And over time, if you look at the experience, for some of the other health programming, they are affected because, once there's no specific line, anybody at all will go in. It's an issue of who is there and the priorities that he or she thinks of. And so I believe that, yes, there's enormous evidence to suggest that we need such a dedicated fund. If for nothing at all, Get Fund is something we can look to. As bad as it may be, at least Get Fund has helped us to improve as it were on our educational infrastructure. So I think that, yes, it is important. It should be dedicated line. And for us, it should not go into the consolidated fund to the extent that any jack can just take any amount of money he or she wants. That is one thing that we need to do. We are saying that it shouldn't really go into consolidated fund. Maybe I'm speaking to my last two submissions. You realize that, I think Dr. Prof also who spoke about during the COVID time, the COVID Trust Fund, we were able to get some money out of it. The time that they were giving accounts, companies were willingly contributing. But as soon as they stopped providing those accounts of what has been used for, then everybody stopped. I myself was part of some work that we looked at. Technically, we call it altruism. To what extent you'll be willing to contribute to anything if it doesn't directly affect you. And people were willing to contribute. But the bottom line is that it should be dedicated to the cause, and we should see transparency and accountability. I believe that it is very necessary. It is important that we establish such a fund. It's the same fund that we are going to go. I know government is thinking about going to get support from the pandemic fund, which is from the World Bank. So if such a fund is not necessary, why would government want to go to the pandemic fund to get money, whereas we can also set up a similar fund that we don't need to pay any interest on? Thank you very much.
Thank you very much, Dr. Emmanuel Ayifa, for your strong justification that there's a need for a public health emergency fund. So yes, there's a need, and that the private sector, they are willing to support if transparency is clear. But without transparency, and I think with the private sector, since they are the majority, they alone can even fund the system, but we have to be transparent, and it should not be politicized, as we have heard previously. So thank you very much, everyone, for your participation. We are moving on to the next, but you'll still be seated here for the next on the agenda, which is the open forum, where there will be questions and answers. Because after this, people may have questions for you. You've said certain things that people need clarification. So I'm handing it over to the MC.
Thank you. Panelists, let's give it up for them. We certainly have a lot of food for thought, and I'm sure that some of us have questions or comments or contributions to some of the submissions that we've heard from our very qualified panel of discussants. On that note, we will spend about 10 minutes to take a few questions. I see someone in the audience already. I will come down with a mic so that we can do this.
Okay. Yes, I'm Dude. You know, I got frightened when the rep from the Ministry of Health said, is there a need for the fund? Because they will have to send the legislative draft to Parliament to establish it. So if he's now asking whether there is a need, then there is a big challenge. Because without the Ministry of Health going to Parliament with a bill, no fund can be established. And with respect to Dr. Ayifa, yes, I mean, speaking from the legal point, you can shout, but is the judge convinced? You said there's justification. Is the man convinced? That is another question. And I believe he's not convinced there's the justification for a fund. But let me just plead, the Ministry of Health, you see, all that you have enumerated, what you did is response. There is nothing that we are doing for preparedness except what the Ghana Health Service does and other people on the ground. And I went through Prof. Binker's slides. You cannot always respond. Post-response, zero. And preparedness, we don't also have the money. So Vaccine Institute, under intellectual property law, you can't produce any unless somebody gives you a license. So the fund, you need it. And I can say, when the fund is established, my worry is what is the vehicle to administer the fund? And that is where Prof. Binker's thing comes. And we should be looking at the vehicle. Otherwise, it will be sitting at the Ministry of Finance and would be used like the health recovery levy and the one we were collecting at the airport. It will be used to buy flower pots. It will shock you. So my brother from the ministry, the fund, we need it. The agenda 111, some are at the footing level. It's not going anywhere. There's no money for it. The Vaccine Institute, we don't talk about it. No vaccine has come yet. So let's get the fund. Let's also look at the vehicle to administer the fund so that they don't go and give 100,000 to University of Ghana and think they can do all the research in the world. The vehicle to do it. You put it at the Ministry of Health, I can tell you, you're in trouble. Thank you very much.
Thank you.
Yes, thank you. My name is Dennis Chirara from UDS. I want to support the last point that my colleague made about the vehicle for delivering the fund. For me, I think the conversation at this stage should not be advocacy for the fund. We listened this morning to a catalog of issues facing statutory funds in Ghana. Our conversation should be geared towards a type of fund that we can save from falling into the same traps, like the National Health Insurance Fund, like the COVID fund itself, and all that. So how do we engage stakeholders broadly in a way that will allow us to define or to frame the parameters around which a pandemic preparedness fund can be set up and will be differently administered from what we have experienced. Otherwise, I'm assuring you, the haste with which we are advocating to set up this fund, it will go the same way that the others have gone. We'll put it in the hands of the same people, politicians, public service functionaries. Their agenda will drive how this fund will be utilized, and our objective will be defeated. Great idea from a civil society organization, but I will strongly urge that our dialogue or conversation at this stage should focus more on concrete things that we will do that will actually ensure that when the fund is set, it will work for the purpose for which we set it up. Thank you very much.
All right, thank you. So talking about evidence-based policies, this is research. And when it comes to funding for research, we always fall on external bodies to get grants for research. I want to know, as a country, do we really have something like that in place that we can fall on? We want to use our students to do research, and in some cases, we personally have to support, in getting the data collected. As a country, I think that is something we need to look at, funding of research. Thank you.
Okay, thank you very much. Divine from Uhas. I want to find out from what our brother in the Fugu said, that when the people speak, the politicians hear. I want to know how we can set the agenda for the politicians to run the commentary. Most of the times they set the agenda and they call the academics to run the commentary on the agenda, what they have put in front. How do we strongly, we've had a discussion over here, strongly push a certain agenda and then they can hear. I was at a forum like this and a presentation, a funded presentation, a work on an impact evaluation on one of the programs in Ghana, a very major program. An impact evaluation was done, funded. Excellent presentation by an academic. Never heard a word in the media space, so no discussion. So how do we set the agenda and push it so strongly out there, like what Prof. Binka has said, so many wonderful things? Will we just go and then we carry it out there as academics and people here? How do we set a strong agenda for them to speak about it and then for the people, for the government to also hear? Thank you very much.
My name is Harriet. I work with Sen Ghana. I'm taking it from where Dr. Dute left off. I want to know, this is to the Ministry of Health. What informed the ministry, including establishing a public health emergency fund in Ghana's medium-term plan, the one that is currently running? Because we have said in that medium-term plan that we will establish this fund. And so what informed that? Is it not evidence? Was that just to please international bodies like WHO or Ghanaians? I think we need a response to that. And then I joined the summit, the Ghana Health Summit yesterday, and there was a submission that when it comes to budget execution, even that of the ministry, we see a high execution rate. But in actual fact, it is the off-budget support that contributes to that kind of high rating, which means that the little that is even allocated to the ministry is not released, and even on timely basis. However, when you visit the Ministry of Finance's website to read the fiscal data, you will realize that we do generate the revenue and we hit our targets. And therefore, the question is, what do we use those funds for? Where does it go? Why can't we have the technocrats in the ministry, Ghana Health Service, join forces with civil society to call on government to release funds when they are in, and also to allocate adequately? Because when sometimes civil society wants to work together with our technocrats, it's very difficult. They do not want to open up. You do not want to speak, and it makes work difficult. We need to work hand in hand to get our politicians to sit up. The will must be there, but they must also be up and doing. We can do this collaboratively. If we don't get your support, we may not be able to achieve the results that we all need. And we have seen that results from the National Health Insurance Scheme. If all of us had added our voice together to call on our government to release the fund, I'm sure we wouldn't be doing 0% last year. Where did that money go? So this is my submission. What informed the Public Health Emergency Fund in the medium-term plan? Thank you.
I think that the panel deserves a chance to respond before we proceed.
We will start from the Ministry of Health, since they got the most of the questions. Then after that, we will proceed.
So I will start from the lady. A lot of the questions you asked are Ministry of Finance questions. But regarding the reason the establishment of the Public Health Emergency Fund was put in the medium-term plan, it's part of the planning. Yes, it is based on evidence. But our experience within this country indicates that because of competing needs, it is not everything we plan that we are able to do at the right time. So looking at this forum, where we have a very interesting marriage of academia and civil society, what I was pushing is that this marriage should focus on putting the evidence together and making the right noise so that you can be heard and heard clearly. So as for policies and plans, there are lots in place. But what is done is based on the funds available. And you went on to give further evidence about budgetary allocation. For instance, early this year, all ministries and agencies receive a fiat. Cut your budget by 50%. What it means is that any plan that you have, you're either going to cut it by 50% or not do it at all. So the issue of advocacy, providing evidence to back the advocacy, has become very critical. And that is what I was encouraging we gathered here to do. It's also a way for us to move from the talk shop business, because a lot of very good evidence have been provided here. But where does it end? We need to follow it up with action. You have the evidence. Doesn't mean it's not enough to talk about it here. Put it together, bring it to the table, and let the discussions go on. Decisions will be made, and then everybody will become very happy. So we are looking at practical ways of getting things done, not just we standing and then saying that it needs to be done. That's all. No. Let's move from the talk shop to action. Then the emergency response, the Ghana's COVID response. I beg to differ that it was only a response and that they have never been preparedness embedded. There's a lot of preparedness embedded. The public health emergency policy, which is being worked on, is one. The upgrading of infrastructure is one. The Vaccine Institute and all the related matters coming up is also one. There are a lot more. So it was both a response, and then embedded within the response was also a preparedness. Yes, there's a lot more work that needs to be done. That will be done. But to say that there was nothing on response, preparedness, that would be a bit inaccurate. I think I'm sure I've dealt justice to the questions that came up. So.
Yes, so the mic will move this way.
Thank you. On the question of what is the vehicle to administer the fund, and I also cannot agree with you more that should even be what we are looking at. Because in terms of the establishment, I believe so far as is enshrined in the medium-term development plan, government has that buy-in to do it. What we are proposing, and this is not just send alone, when we had the key stakeholder discussion about it, which even included the COVID-19 Trust Fund, administrator, some academia, as I said, Ministry of Health was there, Ghana Service was there, Ministry of Finance, the Director of Budget was there. Let me say the cream de la cream of those who matter as far as establishing the fund is concerned. And all of us agreed that it should be an autonomous body. But it shouldn't be that which the president has the power to appoint the person to administer the fund. So the general discussion is that it shouldn't be politicized, so to speak. So it's part of the proposals that we are sending. Obviously, we cannot say it shouldn't include any government person at all. Because no matter what, you need a Ministry of Finance person there, you need a Ministry of Health person there who may not be politicians in a way, but they are government civil service. The plan, if I remember, was to have no more than 50% of such representation. And then the plan is also to the extent that as much as possible, we should also have representatives from the academia, from certain other specific interest groups. And then the fact is also that the fund should be able to pay the management personnel so that it wouldn't be the case that you always need to depend on the government. And when it happens, then it's difficult for them to actually be as independent as possible. I think these are some of the quick proposals that we came to. I'm sure the legal framework, when the discussion comes on, Dr. Dut will highlight a few of the other things that we have to do. Obviously, we cannot do without Parliament as well. So all those things are being put in place. And the last has to do with setting the agenda. Yes, my brother, you are right that we need to set the agenda. Oftentimes, we do things and we leave out the media. Because if you've been in advocacy in our country, sometimes what the politicians fear is it's in the news. And so as civil society, as academicians, we need to at least partner with the media also to prosecute this agenda. I believe that in a way is also going to help. I remember, was it a petition or so, I've forgotten, We had to even use social media to tag the president, to tag certain other key persons in government. And they saw it. And just based on that, they were able to also reach out to us to have discussions on. Yes, we need to set the agenda, but we can bring other people on to help us with that. The last is that the academia should also not to be seen probably to be political in certain things. Because there have been times that I myself have seen some academicians on national television arguing, and purely they are totally on political lines. When you do that and you present the evidence, as credible as the evidence may be, sometimes it will be difficult for governments to accept. And so that is another thing that I would encourage us on. Yes, we all have our political lineages, but when it comes to such, you need to argue and argue right as as an academic, but not as a politician. Thank you.
Well, thanks for the question. When people introduce you as a man in smoke, it means they don't know who you are. My name is Professor Kingsley Kojo with the University of Cape Coast School of Medical Sciences. Yes, your question is very important, and it comes to me as for universities. Let's look at the big opportunity we have as far as distribution is concerned. We are a country with universities almost within a certain enclave of Ghana. We are spread within Ghana. I'm talking about just the public universities, from the north right down to Ghana, which means that at every area that we have a stronghold. The question is, how do we contribute to these health assemblies that are being done in the regions that we find ourselves? It's one of the very strong ways we can influence. In terms of health governance, we need to be seen in there. The universities have the opportunity to also organize forums for the population in educating them on basically some of these issues that are there. Public speaking and all that. I think University of Ghana, I don't know how it came, but they've been doing well with this New Year school thing. I think it's something that should be replicated in the various regions, so the focus will not always be on Accra, because in every region we have our peculiar issues, and the universities must be seen to lead that process. Again, also, Dr. Ifa spoke about our media engagement. One thing I could say is that our experience with this sugar tax thing, we were going knocking doors of media organizations, and they never minded us. But the moment we targeted them for training, in fact, from days up to now, we've been enjoying free publicity. Even Saturday, a media organization had to call me to speak on this issue of sugar and health. So we placing ourselves at the disposal of society in doing what we do best in terms of training. And from the training also, we realize that just picking up media reporters and training them doesn't yield so much. But what yields so much is for us to find a way to target the editors of the media, where the universities have that opportunity to do that. Again, I'll give an example also for stakeholder engagement that University of Ghana School of Public Health used to do. The last time I asked them, how have you been continuing with your stakeholder forums that you've been having? Is it still ongoing? Because it was one of the very excellent programs that during the time of Professor Isabella, they were organized. School of Public Health every year will have an annual program. Those in the various institutions where their students are working are brought to have their deliberations with the school as to how they can turn their programs and all that. This is a way, I'm sure, the cohort that have been trained already, if those processes are still in place, I'm sure by now they would have found themselves where they are supposed to be, because it had that kind of connection. The other form the last form I would say, I'll talk about because of the sake of time, is how the ministries are placing their data at the disposal of the academics. How are we connected? The DIMS was established and all that. The question is, how much was put up in setting up the DIMS?
Did the DIMS look at continuity and then the data usage, how we can help position these data into policy frameworks that can guide whatever we are doing? How is it connected? How does academia get in to get these data and make sense out of what we have? These are very important questions we need to look at. And then also with respect to the data quality, this is also a place academia can be very relevant to the various ministries. And lastly, we talk about research funds and all that. We have projects that have come into this country, malaria control, what, HIV and all that. The M&E, how did we place a budget from these M&E support to support some of these research institutions to do independent work, looking at the programs that we are churning out, and then actually looking at the evidence that in helping the progress forward? I think we have a lot to do if we really want to get the best of academia. And academia also have a lot to do in terms of our responsibility to Ghana. It is unfortunate that academicians feel that they are not listening to us, so the only way we can do is that if you can't beat them, you join them. And that is why a lot of academicians are going into politics and actually destroying the autonomy we have to speak with authority in this country. I cited the fact that elsewhere, very good academicians are put as technical officers or as chairpersons of various serious boards that are into resource mobilization. Maybe sometimes we think that academicians cannot mobilize resource. That is a false, because elsewhere people are mobilizing millions. The fact that Ghana is not really targeting and using people based on their competencies is where we have a shortfall. And I think that going back and looking at some of these processes, we can position our country in the light that it's supposed to be. Thank you.
Thank you very much. We'll take a break from the forum because lunch has been ready for a while. We have another open forum after lunch, after the post-lunch session, and so we'll pick up some of these contributions at that time. On that note, I think that the panelists really deserve another round of applause. And I believe that they have earned the right to precede all of us in the lunch line. And so on that note, I invite them to take the lead and we will follow them in the lunch queue. So thank you very much. We will reconvene at I believe it's 1:30 so that we can proceed. If we're done earlier than that and you all take your seats and we have a nice crowd, we can proceed earlier than that. Thank you so much. Yes, and so online participants, please bear with us as we go for lunch. You can do the same. Thank you very much, and we will come back here by 1:30.
Kofi.
Hello, 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 please. We have about 200 people online, and they are itching for us to start. So please, let's get ourselves in order. 200 online. You cannot hold them ransom. They want to know what's going on. So please, let's get seated. Prof. Nyako. Please, let's get seated and get started. Have we got our next set of presentations? Hello? Those at the back, please find your seat. Without wasting much time, I'll call my co-MC, Madam Maria, to introduce the next presentation. Thank you.
Right.
So I'll move some of the chairs.
Hello. All right. So I want to invite, as we did with the first session, the presenters to come up on stage so that we can interact with them better. And this will be the in-country coordinator of Prevent Epidemics Program with Ghai, which is Mr. Stephen Atasige. Is he here? Give it up for him, please. He will be speaking on the Ghai Epidemic Preparedness Budget Advocacy Framework on building advocacy capacity for domestic resource mobilization towards public health emergencies. And the second person, Dr. Bedima Dut, legal consultant, who will speak to us on building a resilient pandemic preparedness and response system in Ghana, an overview of a legal analysis for Ghana, and proposals for amendment of the IHR and new pandemic treaty. Then we have Dr. John Amwasi, who will be joining us online. He is the Executive Director, ARNTD. He's also a senior lecturer at the School of Public Health at Kwame Nkrumah University of Science and Technology. And he will give us the last presentation, which will be on innovative funding strategies and partnerships, past, present, and future. So, this is our panel, and gentlemen, you are welcome. Thank you. To give us a little bit more background on the first speaker is Stephen Atasige, who is the country coordinator of Ghai. He is a field epidemiologist, a certified project management professional, and also a certified results-based M&E specialist. Over the last 14 years, he has worked as a biomedical scientist in the Ghana Health Service, building capacity in field epidemiology and strengthening health systems. He was on the Ebola response in West Africa team and worked with the African Field Epidemiology Network in Liberia and Sierra Leone as a mentor and technical advisor, respectively, on US CDC field epidemiology training programs. He has also served as a WHO technical consultant in Tanzania, Equatorial Guinea, and Eswatini. Thank you, sir.
Thank you very much, and good afternoon, everyone, and welcome back from lunch. So, before I proceed with my presentation, I want to before I proceed with my presentation, I would want to first of all join Sen Ghana to thank the University for Health and Allied Sciences for accepting to host this maiden symposium with academia. And also thank all those who worked tirelessly to ensure that this is a success. So my presentation will be on the topic advocating for epidemic preparedness, the budget advocacy toolkit that the Global Health Advocacy Incubator is working with. So before I proceed, I would want to first of all introduce to you what we do at the Global Health Advocacy Incubator. So we support civil society organizations and also government institutions and individuals who advocate for public health policies that reduce death and diseases. So our work in the health clusters include health systems strengthening and budget advocacy. Specifically, we do interventions on data for health and immunization and primary health care and the Prevent Epidemics program. We also carry out interventions in food policy and nutrition, which includes cardiovascular health, food policy, and legal defense funds. The third is injury prevention, which includes child drowning prevention and road safety. The Global Health Advocacy Incubator operates in over 60 countries in over the last 20 years in all these areas in the health cluster program. Specifically on the Prevent Epidemics program, our goal is to raise public and political awareness for epidemic preparedness as a national priority through locally led advocacy campaigns, as we are doing with Sen Ghana. Specifically, we seek to increase and sustain domestic investment for health security, as this is what is required by the Global Health Security Agenda, and also based on the lessons the world has learned with COVID-19 and other emerging infectious disease outbreaks. We have worked in countries in the past like Senegal between 2018 to 2020, presently in Nigeria since 2018, and Nigeria, the Global Health Advocacy Incubator Prevent Epidemics program operates at the federal level in Kano State and in Lagos. In Ghana, we have been carrying out this intervention since 2020 to present, and started off in Uganda this year as well. So before the Prevent Epidemics program, the Global Health Advocacy Incubator also initiated an intervention in food policy, which the University of Ghana School of Public Health has been leading, and we also be rolling out the immunization and public and primary health care intervention next month in Ghana, which also falls under our health cluster programs. So, why the Prevent Epidemics program in Ghana? The Ghana context. What prompted us to choose Ghana and to specifically decide on the policy objective or goal on which we are working on? As has already been indicated or said by previous speakers, this is a requirement as it is a WHO benchmark for the international health regulations capacity. And it's required that states do have domestic funding for IHR implementation. So as we spoke or earlier on talked about evidence-based advocacy, it's good to reference that the joint external evaluation of the WHO in 2017, that was, reported in 2017 after an evaluation by experts. Ghana scored 2 on a scale of 1 to 5 in the technical area of national legislation, policy, and financing. So this is, of course, enough evidence, as this is based on expert evaluation. Also, going by the joint external evaluation in 2017, the findings of the team identified the need for national budget, the need for a national budget line for sustained funding, logistics and human resources, as well as financing the needed legislation. Now, the score of 2 is evidence on the fact that at the time, the country had not yet implemented clearly or finalized the regulations of our Public Health Act, and much hasn't changed since then. Now, the most recent evidence is the 2021 Global Health Security Index. And then, under this index, which scores countries or evaluates countries on their preparedness, Ghana scored 27 out of 100, with no change from 2019. This according to the Global Health Security Index. So, based on all of these evaluations by experts, external experts, and of course, the JE also includes, since it's joint, it includes our own experts also contributing to it. The recommendation based on the 2017 JEE is for Ghana to establish an emergency fund with a clear mechanism for accessing the fund in the case of an emergency, clear guidance on triggers for release of the funds, and monitoring and accountability processes for implementation and utilization of the funds. This was a recommendation of the JEE report. What is the current situation? The recommendation, as we have all come to establish today, is that it has not yet been implemented. Now, currently, when there's an emergency, we have come to also learn that the government secures funds from the Ministry of Finance, and even with that, the ease of access remains a challenge, and there is no clear mechanisms for accessing those funds. This was based on, or according to a situational analysis report in 2021, which was carried out by Professor Ernest Kenu as part of the enhanced strategies to protect and improve health security in Ghana. So, based on all this, landscape assessment we did, we employed, together with our partner, Sen Ghana, the budget advocacy framework, which has proven to be a tested cycle to ensure budget advocacy and funding sustainability. The first step of the cycle is campaign planning, and the second step is campaign implementation. At the point we are now is campaign implementation. Now, after campaign implementation, it is hoped that we would achieve budget increase or allocation of sustainable domestic financing for epidemic preparedness or emergency preparedness. The third stage is budget accountability, and the fourth is budget sustainability. As we move on, I would walk you quickly through these steps. So, each phase of the campaign has strategies and expected outcomes. So, it's expected that at least in the first phase of campaign planning should take at least 3 to 9 months. The second stage, at least a little over a year. The third stage, 6 to at least a little over a year. And then budget sustainability is required to be an ongoing process. So the overall expected outcome of these phases of budget advocacy, of the budget advocacy cycle, is to ensure increased public awareness and demand. That's 1. 2, to raise political will. And 3, to build country ownership. Now, the country ownership is based on how civil society organizations, coalitions like academia, journalists, take this on and then continue to ensure that the campaign is locally led. Now, specifically at each phase, there are expected outcomes. But as we move on, we could have a little gist of it. So, in campaign planning, we conduct a landscape analysis, which we carried out to inform the decision on which policy goal to pick or to choose for address. And this is based on a full assessment of the local country context and also assessing the epidemic preparedness status of the country. And that takes us to the Joint External Evaluation Reports and other existing reports that go to show what the country's preparedness status is. We can also refer to the NAPs, among others. Now, the funding gaps, costing, and budget is also another, aspect of the landscape analysis. And that takes us to the National Action Plan for Health Security. This shows us the funding gaps, what the costing has been, and the budgeting to give us an idea of what to expect. We did a political mapping that includes assessing the political stakeholders who matter in ensuring that policy changes can be made. And then the budget mapping process to be able to track and to be able to, specifically know at what point of the budget process in the country we need to implement what level of advocacy. The legal analysis is also very crucial as it gives us a sense of the legal gaps and the legal opportunities that exist to be able to have a more, clearly targeted advocacy. When you understand the legal framework or context of the country, it makes it easier to make the case to, for instance, Parliament and policy decision makers. So in identifying our policy objectives, we sought to identify the policy actor who or which institution should carry out the policy change. In this case, our target is the Ministry of Finance. The Ministry of Health also has a role to play. And who should make the policy decision for policy change also matters. What kind of policy action do we require? And as we discussed, we're talking about the vehicle. The vehicle, of course, it takes us to what sort of policy action are we calling for? Is it a legislation? Is it a policy change? Is it a funding increase or allocation? And I think in our case of calling for a budget, for a public health emergency fund, it's more of legislation first, and of course, it's more of funding and increase in allocation. And when should we have the change? It's also very key. So the process of planning is followed by the implementation, which is very critical. The implementation stage is very critical to this budget advocacy cycle because it is at this stage that you are able to make that impact you seek. And it starts with the building of coalition of advocates. The building of coalition of advocates includes bringing together all those you believe are potentials to make the change. In this case, we identify academia, and that's why we are engaging academia. We talk about civil society organizations. The media is key. Members of parliament have been on board with us as, champions and also as part of a coalition. Now, in designing a media campaign, we have been able to employ a lot of owned social media and as well as paid and print. And that is why I particularly was very intrigued by a question that came from one of the audience on how do we set the agenda. And that was a very useful question because in implementing the campaign, you need to ensure that there is a very well-planned media campaign, and that includes setting an agenda. That includes ensuring that there is earned media generation as we are doing. We are hoping that beyond today's gathering, we are able to generate that earned media, which includes paid in print or even on television, on radio, on digital platforms, and we are hoping that the media present would help us to amplify our message. We are also counting on academia to hopefully after this session or after today's program proceed with probably carrying out some communication to policy decision makers in whichever form we may find fitting or appropriate so that we are able to set the agenda for the discussion beyond today. So budget accountability is when we are able to ensure that the advocacy does not end with a budget increase. Now, in our case, as Dr. Ayifa earlier mentioned, unfortunately, Ghana is doing very low. Our health budget is quite below the expected Abuja standard or what we signed to in the Abuja Declaration. However, we are hoping that can increase. And that is why stakeholders, including civil society organizations like SEND and the Global Health Advocacy Incubator, believe that one opportunity we have as a country to ensure the deliberate increase in Ghana's health spending is when we have ring-fence financing, when we have dedicated funding, especially for epidemic preparedness. And there's, another opportunity is because we have experienced COVID. It has taught us a lesson. And as humans, you would tend to agree that should we let this slide? And when the waters calm, we would forget what we went through. And that's why we believe it's good to take take advantage of the moment and ensure that we continue to press home the message for the need for the Epidemic Preparedness Fund. And again, budget accountability would include tracking of budget allocations. So in our case, we haven't gotten here yet. We are hoping that our efforts would get us here, where we have one day pat ourselves in the back and say, yes, we together achieved the goal of having a public health emergency fund. Now let's ensure its accountability. And I think that has been one of the topics or the issues of concern, accountability. And then sustainability. Budget sustainability is something you have to demonstrate value for resources spent by monitoring and evaluating impact. And sustainability also falls on us as both academia and civil society organizations, because we need to continuously put government on their toes and ensure that indeed, whatever they spend is used for the right thing, and ensure that it goes into providing the prevention, the preparedness and response capacities that we seek. So this is the toolkit resource. You can go to budgetadvocacy.org. Once you just get into budgetadvocacy.org on the internet, it will take you to the resources. You would see clearly the worksheets and all that you can see on the screen. And you can also go through a more comprehensive detail. So what we are doing at the Global Health Advocacy Incubator now is to ensure that we are building a prevent epidemics advocacy tools. First, we are looking to support the budget advocacy framework for increased and sustained epidemic preparedness investment. So these tools we are designing are targeted at civil society organizations, and government officials. And it can also be adapted for the training of public health practitioners by academia. So we are working together with some experts based on the experiences we have gathered as an organization in budget advocacy. So all these examples and experiences are being drawn into developing a very comprehensive budget advocacy toolkit for epidemic preparedness. We're also developing a facilitator's guide. Now, the facilitator's guide would help any people who want to learn on how to teach or train people on budget advocacy, and also provide them with the resources required. And of course, we also have the budget basics, which also plugs into the experiences in other countries, the experiences of how budget advocacy is carried out. Now, budget advocacy, or advocacy generally, may seem to be a simple thing, but actually, when you look at the complexities of humans and the systems in which we work, you will agree that it has to be planned, it has to be systematic, and it has to be well intended. And so we believe that this tool will go a long way to train and build capacity. And we also think that academia can plug in. The facilitator's guide, for instance, will be put online. It's going to be an online facilitator's guide that will support groups of people to implement the toolkit in a collaborative and efficient manner. So the audience include facilitators leading a group of civil society, organizations, coalitions, government officials, and also academia. So once we complete the facilitator's guide, which is still being developed, we would open it up to the public, which includes academia, and we believe it can be adapted. It can be adapted for the purpose of training. And we know that academia has the power, academia has the influence to convene, academia has the skill to deliver trainings, because that is what you do. And so we think that academia is in the best place to also adapt this for purpose. As a public health practitioner myself, I have come to learn that advocacy, as we may not really see as part of our work, should change. Because many times you may find yourself as a public health practitioner, either in whichever capacity, being affected in one way or the other by the fact that certain policies are not going as expected. For instance, we all witnessed the recent crisis in immunization in Ghana. And I believe that is something that should worry any public health practitioner, because when you think of the efforts you put in to ensure safer public health or better public health systems, and then because of a policy or lack of something, the clock is turned back. So it's like your efforts have been reversed somehow. So I believe academia can tap into this, and the Global Health Advocacy Incubator is opened to talk more, to discuss further on how we can collaborate with academia in making use of this advocacy toolkit for epidemic preparedness, which can be adapted, improved, even to your own specifications as you deem fit. So thank you so much, and I urge you all to log into the website, budgetadvocacy.org. As you can see there, it is in both English and French, so you can learn more about the toolkit. And we are open to questions. I can share emails on further questions you want to ask the Ghai as an organization. Thank you so much.
GW 733317. Please move your vehicle so that someone can leave. All right. So, our next speaker, who will be taking us through presentation number 5, has a very interesting background. And I'm sure he will correct me how to address him, but I will go with what I think makes the most sense. So, Dr. Bedima Dut, Esquire, is our next speaker. Dr. Dut has been a district director for health and a lawyer also for many years. He has qualifications in law, public health, and pharmacy. His specialization is actually in global health law and governance. He attended KNUST, has also attended the University of Ghana, Robert Gordon University, UK, Manindal University, Thailand, the Hebrew University, Jerusalem, Israel, the Graduate Institute, Geneva, Switzerland, and the National University of Singapore. He has a PharmD, so he is the pharmacist, and he was recently sworn in as a circuit court judge. Ladies and gentlemen, to speak to us on building a resilient pandemic preparedness and response system in Ghana, an overview of a legal analysis for Ghana, and proposals for amendment of the IHR and new pandemic treaty, is the person very, very, very qualified to speak to us on this topic. Give it up for Dr. Bedima Dut.
How do I control it? How do I control it?
Oh, you're fine. This one. This will move you forward and then backwards.
Okay. So, good afternoon. So, you should have said, Your Honor. Okay. Because many people have already presented, I'm going to skip a lot of the slides because I went through Prof's slides. I've gone through a lot of the slides, and sorry, with respect to academia, we had a professor who was teaching us microbiology. When we went to first year, we took those who were in fourth year, the notes was the same. So we went to class, he came giving the same notes because we had read it. So we said, Prof, for the past 3 years, why? The same notes. He said, the organisms are the same. So, because the problems are the same, the slides are likely going to be the same. Okay, so because you are in academia, I want to invite you to, probably in the local language, how do we talk about public health emergency, public health threat, global health? How? So that on Peace FM, they can discuss it. So probably try and look for those terms. And if you want to engage the media, some of these terms, you have to look at them closely. Now, when we say public health, and as I speak, I will now divert your mind, because you are technical physician and disease control and all those specialists. You look at it as a noun phrase, public health. Or you look at the word public as an adjective, and it will give you a certain sense. So if you were, sorry, I should go here. Oh, okay. So if you were to look at public health in its sense and in its legal meaning, what we are saying is that it is the public, either by itself as a whole, a unit, that has the duty to act. In fact, if you don't get this principle right, the UN would have sat down. So when there's COVID, the question is, who is supposed to act? But because of this legal, philosophical understanding of public health, the public itself has a duty to act. But the public doesn't have, what do we say in law? They don't have a soul. The public doesn't have a soul. It doesn't have a heartbeat. It is the individual members of the public. And the public is also the beneficiary. So any public health activity that you do should not go to the benefit of an individual. It must inure to the benefit of the public, even though individuals are members of the public. But your target cannot be an individual. Your target must be the public. And I believe that is why this symposium has been organized. Everything we do should be target the public. Otherwise, some individuals are so rich. Now, I don't want to go so much, but you know, when we had the COVID, and we all looked at the problems that, we did some legal analysis, and we did some research. Academia, you are doing very well, but you see, Ghana is not a reading public. We don't read. You see, these days, it's only WhatsApp they read, the young guys. So you can even publish a lot. People will not read. That is the challenge I have now. So, because we're not a reading public, we don't even know there's a place called Uhas. People don't read. Not that you don't publish, but we don't read. So I don't know what we can do to the young generation to cultivate that reading habit. Otherwise, all your published work will go nowhere. We don't read, so how do we know you have published something? That is the challenge we have. So I'll just take a brief look at it and then give you some brief proposal, because Prof has already spoken about everything, and then give you some international dimensions, and then we'll close. So, pandemic, the phases, preparedness or readiness. I think Africa CDC is now talking about, we should stop using the word preparedness, we should talk about readiness. They say we've been prepared for a long time. We now want to talk about pandemic readiness. And then there is, get an instrument to measure readiness. But I'm not worried about that. But we all generally agree that these are the phases that we go through. But there is another phase, post-response. So people came, they had COVID, you gave them oxygen, you discharged them. What has happened? Who knows what has happened to them now? And that is the challenge of the health system now. The post-response, it seemed to be absent. So if somebody was discharged and the virus has become resistant and will come back stronger, well, nobody is monitoring. And so if somebody has meningitis and you have treated and the person has gone home, at least our health system should be able to track them 2 weeks, 3 weeks, and find out how you're faring and how everything. I don't think we have that. So we did some legal analysis and we asked certain questions with a lot of NGO. Whether or not, and this is where the Minister of Health should listen, whether or not government programs or institutions had money, whether or not there was enough accountability and things. And then we use an internationally approved instrument. Now, I think CDC has an instrument like this. WHO too has seen it. When you say that a public health system is good, what are you talking about? If you say you have a resilient public health system, what is it? And these are the generally accepted characteristics. There are 12 of them. That if there is an outbreak or an emergency, they must address the full cycle. That there must be triggering events. I think people have already spoken about them. How will you trigger the events of an emergency? So there must be, authorities must have the tools to be able to work. There must be sufficient funding. In fact, this instrument and these international characteristics is what they use to assess any country now on whether it has an effective public health system. It goes to the JEE. If you go through the JEE tool, They are all the same. These are civil societies that developed these ones. So this was used. And in Ghana here, you see, the activities overweigh the funding. It is true. The evidence is overwhelming. I don't think we need to debate that. We just don't need to debate that. So when we did the work, we reviewed a lot of legislation, almost about 17 of them. Some, about 17 of them. And there were so many funding gaps. But what I want to stick on is, you see, I think Prof. Binka mentioned something. The Ghana CDC. In Ghana, based on the legal analysis we have done, who is responsible for surveillance and public health activities in a faith-based hospital? Who is responsible? Because the Director General of the Ghana Health Service doesn't have mandate over them. So the question is, who is monitoring epidemics there? That is even why you need a body like the CDC with an overarching mandate. Because when the Director General of the Ghana Health Service is addressing the media and addressing the TV, with due respect, my boss, the chief executive of 37 doesn't see that that is his boss. Or Kolebu Teaching Hospital. Because you have the law saying that it is teaching hospitals, Ghana Health Service, and teaching hospital. Disjointed end. That's what it is. You know, we can have a conjunctive end and a disjointed one. This one is a disjointed one. It says Ghana Health Service and Teaching Hospitals Act. By that time, Trafalgar, who was in there, we are going to get about 100 teaching hospitals in future. All of them coming under that law. Is it possible? So, we need a body that must have all the overarching mandate if you want to really have, and that is why the CDC, they have to look at it again. And if they want to do it, they should do it and do it very well. So it doesn't have. Now, in Ghana, when there was, what do you call it? The epidemic and the pandemic, they brought the money, but they disbursed it under what they call disaster support program. Now, disaster is different from a public health emergency. And one of the professors said we should try and empower NADMO. NADMO, you don't know. If you are not careful, they will go and even, you cannot control. NADMO is disaster. Disaster is anything that leads to disaster is anything that leads to loss of property and life. And look, flood, everything, they will always be there. So I would suggest that if you want to do public health emergency, narrow it down so that you can have your. I'm in an academic institution, so I have immunity. So disaster. So when this thing was, when the money was brought and was disbursed during COVID under disaster support program, that is how you saw the district assemblies drilling the boreholes. That's how they were in the market spraying with chlorine and said that they were spraying COVID. Yes, that's what happened because the money was disbursed under a disaster support program. This is why you need a fund to target the fund and make it impossible for people to just use it for anything. So boreholes, they said, it's for health. But the people don't have water. And they put dustbins all over the place. We went a month, after 2 weeks, no soap, no water again. The dustbins are still there. This is the problem with Ghana. All right. So, if you look at our current sources of funding, and you see this is where we are, consolidated fund is not always enough. Contingency fund, when COVID came, everything was dry. Internally generated fund, the district assemblies don't have. Then they said they should use IGF from the health facilities, but that is insufficient. So largely, it came from donor funds, loans, and grants. This is what happened. So you realize that this current if you are talking about epidemic or pandemic preparedness at the local district level, this is how the funding flows. From the Ministry of Finance, Ministry of Health, Ghana Health Service, Public Health Division, Regional Health Director, District Health Director, before it will get to the community level. This is the bureaucracy. And that is why it can never be sufficient, because it decreases as it goes down the line. You see? So if you want to create a fund and retarget it, I can tell you, you must target the district and the community. And make sure that you cut out all this long chain. Because otherwise, they will adulterate it. Okay. So we relied on this. All this consolidated fund. We enacted COVID-19 Trust Fund. That fund the board has been dissolved, so far as I'm concerned. It's no longer there. The health recovery levy, 1%. And then the one we're collecting at the airport. Now there's evidence to show that the 1% that we are taking, we have used it unrelated to COVID. Unrelated. We've bought V8. We have even received visitors with it. Yes, the evidence is available. Okay? This thing generated about $400 and something million. But the money, yes. And now, if we get COVID today or epidemic, I don't know, what are we going to do? Because we have borrowed ahead of our grandchildren. Okay? That is why you have to look at it very carefully. So I still think that we need to establish it. And the 1% COVID levy, if we could rechannel it to establish the public health emergency fund, it will help. Otherwise, it will be used in another way. And how are we going to create the fund? Okay. Now, I want to look at international dimensions. The question you always ask is that, so when there's a pandemic, who becomes the global watchman or policeman to make sure that you quarantine the pandemic? In fact, this is what international legal experts always question. Who is responsible for fighting the pandemic? And so that is why the UN rose to the challenge. The UN is the one that represents the whole world. And therefore they are. And the WHO becomes the coordinating body for the UN. So after COVID, they thought something must happen. So my brother from the WHO, if you understand the UN architecture very, very well, you will see that you see WHO under the Economic and Social Council. And if you see how it is, all of them. But WHO is specialized agency of the UN. And it is the body that has the mandate to coordinate pandemic preparedness and response. So you cannot do anything and talk about preparing Ghana for pandemic or emergency without looking at what the WHO is doing. Because what you do here, it will not be binding on them, particularly if the organism has to spread all over. Because the global health architecture is very, very complex. Very, very complex. And WHO sits in the middle there. It coordinates a lot of bodies, Bill Gates, Pfizer, COVAX, and the UN just sits and then it supervises all that it does. When COVID came, these problems became manifest. The surveillance systems were very weak. The global health systems fragmented, insufficient. National health systems were overwhelmed. We were better. And in fact, the world wasn't prepared for COVID at all. The world wasn't prepared for COVID. But I have always asked myself, like Stephen made a presentation, why didn't the world ignore the writing on the wall? Because as of 2019, the Global Health Security Index indicated that no country was fully prepared for epidemics, but we kept quiet. So if COVID, this thing happened, by 2019 we were aware. But everybody was quiet. Now, after COVID and after all the problems, what has been the recent discussions? People have questions. International experts. Is WHO enough? Do we need another body? Do we need to reform WHO? And no, with due respect, when people say reform WHO, you remember when Donald Trump took the US out of WHO and later on came back? When he said reform means I want to change somebody. But that's not what we are talking about. But I'm saying that people have started questioning. Do countries have the capacity to do what WHO is saying they should do? These are the questions. Do we invest enough? Do we have the budget? What of the issue of, human rights, environmental health? For Ghana, I say our One Health, I don't know how it will operate. Because when you go and the environment, when there's now outbreak of anthrax. So it has been declared by the Minister of Agric. You don't see who is bringing the health and the other people together in terms of One Health. So the regional directors of health for Upper East and Upper West are also warning people, don't eat this. This one too is saying, don't eat. So, question, who is bringing them together to work? So our One Health approach is a challenge. So, WHO has a limited, so during COVID, yes, we must understand it is our WHO. But, they are more diplomatic. They don't have what we call the power of hard law, like a police. If you say police say stop, and you say you will stop, they will drag you and then put handcuff. No, WHO doesn't have that card. They do diplomacy, you see, and they persuade. And that is where the challenge is. Question is, do we need to give them more power? Don't you think we need to give WHO more power? The last one is that WHO, 80% of its budget is from contributions from member states. And if you contribute more, you can talk more. So the question is, why don't we let WHO become independent and give them sufficient money so that they can call every nation to order? And that is the view some of us think, because otherwise, anytime they talk, then somebody will say, I will be threatening you, I won't bring my contribution next time. You see, we need to empower the World Health Organization, which is ours. And all these discussions came after COVID. I don't want to waste here. But there is a consensus that the global health system is weak and that we need to do three things. One, we need to reform the WHO. I don't know how. Two, they need to enact a new legislation. Three, they need to amend the IHR. After doing this, you get a stronger global health system. The reform for WHO, let's leave it. But number 2 and 3 are ongoing. Number 2 and 3 are ongoing. So I'll just give you updates on number 2 and 3. Because the IMB 5 will start on the 12th, right? On the 12th, next week, towards a new pandemic treaty. And it will change the way all that you do. Probably change the way you teach at Hohoi. I believe so. Now, let me go over this. The proposal for a new international instrument or a global treaty for pandemic preparedness and response, it was first suggested by the President of the European Council. I think I need to let you know this. In 2020, in 2021, 26 heads of state and WHO Director General supported the idea that, listen, we need a new law. Because after pandemic, people were hoarding vaccines. Some had enough, some did not have, and there are other things, particularly the sharing of pathogens. The question that poor countries are asking is, pathogen under what we call the Nagoya Protocol is property. So if you have pathogen in a hole here, any virus, the outbreak, it's your property. Can somebody just come and take it? No. So China was not sharing the pathogen like that. He said, it's my property. I have discovered property. Now, Now, poor countries are saying that, well, you can come and take the pathogen, go and develop treatment and treat your people and leave the poor man to die with the pathogen. Is that fair? These are all the things. So, what instrument? I think I saw something. In December 2021, I think the World Health Assembly said that there was a meeting which they titled The World Together. And they agreed to pass an international instrument. And when we say instrument, a law, but we don't know what the law is called. So generally, when we use the word instrument, it could be an act, it could be a legislation, it could be, what do you call it, a bylaw, but it's an instrument. So when we say instrument, that is the generic term. Like people have been used, you call microbes. You understand? Now, so what happened? The World Health Assembly established what they call Intergovernmental Negotiating Body, IMB. The IMB is chaired by South Africa and the Netherlands. Brazil, Egypt, Japan, Thailand are the co-chairs. WHO serves as the host secretariat. And this is the second global health treaty to be negotiated under WHO, because the first one was the Framework Convention on Tobacco Control. Now, what can they adopt from the legal perspective? What can they adopt? Option 1, it could be a convention, Article 19 of the WHO. I think Prof. Binka mentioned that in the IHR. Option 2, it could be an agreement. That would be the name. Option 3, it could be regulation like the IHR you have. Option 4, they can also just issue a recommendation. These are the only 4 things that can come out of any new law under the WHO Constitution. So what did they do? They said that the decision, the IMB is the Intergovernmental Negotiating Body. They met and said that they will proceed under Article 19 without prejudice to Article 21. Look at it. They will proceed under Article 19, that is a convention, without prejudice to Article 21. Is it clear? What it means is this. They are going ahead to do something like a convention, but it could turn out that it will be a regulation they will issue. Now, let me explain something so that you understand. Article 21 is a regulation like the IHR. It has a limited scope. And I saw Prof. Binker's slide. A member state who do not object, it means there is no opt-out. But Article 19, you see, it would have a broader scope and can only enter into force when you sign. But the IHR is binding on you until you say, I'm not part. But what is coming now, you will be as required. If it's under Article 19, every country, if you want to be part, you have to sign. So there are implications. And the treaty is on the verge of being completed. I will show you the timeline. 2024, we are likely going to have it. And as academia, it's unfortunate that Ghana, we don't have the resources. You should have been providing us with the background. Because Geneva Graduate Institute, Georgetown University, they are doing a lot. But we don't have you should have been providing us the background, architecture, and support to support. Because Ghana have been participating by Zoom, and the Ghana delegation have been going. But I have not been happy with the level of contributions. My brother, don't go and tell anybody. But South Africa, Botswana, I think I've been listening to them. Nigeria, big brother Nigeria, Kenya, I can mention them, you see. So, but the truth is that if you don't get academia to give you the research work and the evidence, if you get up, you can't speak. That is the problem we have. Because if they don't give you data and you get up and go to Geneva, what are you exactly going to say? So at times they'll call me and say they are going for lunch. I say, okay, good luck. Now, let me tell you something. The IHR, Prof mentioned this, so I don't want to go there. But this is the weakness of the IHR, as I know it. When we say deep prevention, you see, when people talk about zoonotic diseases, and that is a spillover from monkey to human, that is what we are always saying. So from the monkey to the human being concerns all of you. What of the circulation within the monkeys? Nobody talks about it. And that is deep prevention. Because if you don't stop circulation within the monkeys and continue to circulate within the monkeys, it will come from the monkey to the man. So the IHR doesn't talk about deep prevention. Now, IHR, it started with quarantinable disease, but now it is for everything. So the law is that it has to expand to accommodate bioterrorism and hazard. It started a long time ago with just 6 diseases. And it also has opt-out but no opt-in. So once IHR comes, it binds on you. You can't say, I don't like it. So if you look at the IHR, there are certain portions that African countries don't like. But what can you say? So it's a weakness. And the expectations that every country must do, the question is, can they do it? Do they have the capacity? And as we said, data, pathogen sharing. How do I share a pathogen to a rich nation that will do genetic sequencing and then get a vaccine and use it again? And then you, the one who started with the organism, you are still sitting down, no treatment. Because that is it. And there's no fund to also implement the IHR. These are some of the limitations that we have. Okay? That is why they said it has to be amended. How will it be amended? And that is why, so there was a working group on IHR reforms. And this group is working parallel with the new pandemic treaty. And so far, they have met, and with the pandemic, as I follow up, almost about 20 times. The IHR amendment, there are some key proposals that are going on. And public health emergency of international concern, the view is that it should be limited to regional levels. Even though, because international, at times, what is for the Afro region is not of concern to the Americas. And so you are waiting for somebody in America to act on something that is between you and Côte d'Ivoire. It will delay. And so these are all proposals. There's also sharing of genetic sequencing, equity. If you come and take the organism from me and go and do the vaccine, come and treat me first before you send it back. That is what the poor countries are saying. But the rich countries, America is asking, so who should be developing the vaccines? Who should put his brain and money and be developing vaccines to come and treat somebody free? They are asking the African governments. So there are a lot of things that are happening. It's not going to be easy at all. So the timelines, as I said, from 2020 we put it up. The zero draft came in 2023. The conceptual zero draft is what is being they are using now to discuss to get the first draft. IMB 5 will start next week. The other ones are also ongoing. By 2024, we are likely going to have a new pandemic treaty and a new amended international health regulations. That will be submitted to the UN General Assembly. And if it is approved, it will change a lot of the things you do. And so, as academia, you need to take interest in it. And the way you do your research, the way you get funding and all that. But when a new law comes, I can tell you, if every country doesn't get the needed funding to implement the provisions, yes, they will help you, but you will pay through the back door. It's not going to be that easy. There are contentious issues, international politics. If you are following the discussions, because Eastern Europe, they think this thing was proposed by Central Europe, the European Council. I think at the IMB, US alone went with about 500 negotiators, and we went with 1 or 2. They are there. They went with about 500. Each provision has a special group. Each single provision. But no, we are there. I think we are 2 or 3. I don't know where they are. So, international politics. People are looking 100 years and beyond. What can they get for their continent when this law comes into force? I think we are just, I don't know. We are there. We are there. Now, equity, access, medical, intellectual property. Intellectual property is dominating discussions. The question is, Pfizer, the manufacturer, big pharmaceutical giant, they say, well, so we are going to discover the vaccine. And how is it going to be free? Yes, we are ready. We want to give it free. But who will pay? UN, are you ready to tax people so that at least we can recover the cost? So there are a lot of issues that is going on. And I'm just waiting for 12 to log in. It is very, very interesting when you hear all the professors talking, and our politicians at that time, they are very quiet. They don't want to talk. Compliance. IHR, people can just flout it. This new law, they say they won't allow that. That you can just, no compliance. Some people don't have focal persons. They can decide that they won't. No, it's not going to be that way. They are going to make sure that there's enforcement. So, I think back home here, when we did if you establish the fund conceptually, it should look like this. And you see all the other agencies, initially we had academia and all that, but somebody will say, you didn't mention me, so we lump all. So all other agencies should be able to withdraw money directly from that fund. Direct. The Ghana Health Service headquarters or whatever, their money from the fund should be different from those from the district level. But more importantly, there must be an accountability system. And I think this fund will help a lot. Because Ministry of Health will sit somewhere in between the fund and the Ministry of Finance. But the fund must have power. If we don't get this, and then we get a vehicle, if we are able to establish the Ghana CDC as a vehicle to administer the fund, I think we would have made we'll make a significant way. So I want to join the Send Ghana and Stephen and Co. and say that all of you, let's support academia. Come out with the write-ups and the research and that. So thank you very, very much. This is the end of my presentation.
Thank you, Dr. Esquire. And so the last presentation is going to be a little different. The presenter is not with us and is not able to participate live on Zoom. However, he has sent in his presentation and will walk us through it via video. So kindly bear with us as we set this up and proceed through it. This is going to be new for all of us. So I am just as excited as you to listen to Dr. John Humphrey Amwasi, who is a senior lecturer at the Kwame Nkrumah University of Science and Technology, where he heads the Global Health Department of the School of Public Health. He's also the group leader of the Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine and the Bernard Nocht Institute of Tropical Medicine in Hamburg, Germany. His research mainly involves clinical and field epidemiologic studies on emerging and re-emerging infectious diseases. And on that note, IT, are we ready to go or not yet? A couple of minutes. Oh, half a minute. Okay. All right. Dr. Amwasi is also leading currently both hospital and field-based studies on COVID-19, including drug and vaccine trials. He serves as an adjunct professor at the University of Minnesota School of Public Health and is an honorary visiting research fellow in tropical medicine at University of Oxford, UK. We will wait for IT to finish setting this up, and then I will go through the slides while we listen to the video. Thank you.
Good day, everyone, and apologies for not being able to join you in person for this talk. It's owing to prior commitments which coincided with this, but nonetheless, I'm happy that I could have this recorded and shared with you. I'm going to be speaking on the topic funding and research for pandemic preparedness, which I think is a very critical topic today when we're just coming out of COVID and we've had the scare of the Marburg outbreak in Ghana, followed by the Lassa fever outbreak. And this Marburg outbreak also happened in Tanzania and Equatorial Guinea, all making us realize that we are in the pandemic era, if we can put it that way, or epidemic era. And we need to be ready for this. We need the knowledge that will help us to identify these early enough, if not prevent them, and the knowledge that would help us to develop health products, drugs, vaccines, and diagnostics to be able to address these outbreaks. I'd like to start by acknowledging my research group, the Global Health and Infectious Diseases Research Group at the KCCR at the KNUST in Kumasi, as well as my department at the School of Public Health, the Department of Global Health, and the Dean of my School of Public Health. I want to go straight into this presentation by speaking to the need for clinical research on a more broader level. And in clinical research, we're thinking more about both clinical trials as well as other clinical research. For clinical trials, we're thinking about trials of drugs, trials of vaccines, and trials of diagnostics. All these are needed within the pandemic space. And obviously, we know that clinical trials require significant funding, not just for the fun of it, but because of the kinds of the processes that are needed in order to conduct a clinical trial according to good clinical practice, the kinds of personnel you need, the period of time required, all calls for funding. And there's also other clinical research which is really critical. Simple research, otherwise simple research like clinical characterization studies when there's an outbreak of a hitherto unknown disease, like what happened with COVID. It required clinical characterization to understand how it presents if it help us understand what it could be. There's also clinical outcomes research. What is the outcome of the illness beyond just the presentation? What do we end up with? And then there's a further on health outcomes research. The global distribution of clinical trials shows clearly how Africa has been essentially left behind when it comes to clinical trials, even clinical trials for neglected tropical diseases, for which Africa really bears the brunt of it. Over 80% of the world's burden of NTDs is found in Africa. But if you do the math, you'd realize that there are many, many clinical trials for NTDs which are not carried out in Africa, particularly some of the early stage clinical trials, not to speak of clinical trials for emerging and re-emerging infectious diseases. So clearly we have a big problem. And there's not only this disparity in numbers of clinical trials and them being conducted in Africa, but even the number of trials by income groups. You'd realize that those in the lower socio-economic strata have less an opportunity to be involved or engaged in clinical research or to be represented in clinical research, particularly clinical trials. And this brings into question the representativeness of important clinical trials for health products, i.e. drugs, vaccines, and diagnostics, which would be targeted globally. I want to go on and speak again still on the need for clinical research in Africa. I'm just showing the map on this slide. You would realize that Africa is really at the lower end when it comes to clinical trials. You can see how in Europe and North America so much going on, a bit more in Southeast Asia and Eastern Europe, but very little in Africa. If for anything, the COVID-19 pandemic has shown us that the unique nature or structure of Africa, both in terms of the socio-demographic as well as even the genetic composition of Africans and its rich diversity, I should tell you that if there's any place which needs representative clinical trials, it is Africa. And we're still trying to unravel the mystery of COVID in Africa, where we saw how the infection spread just as widely as it did in other parts of the world, and this is evidenced by various seroprevalence studies. However, the mortality and morbidity from the disease was clearly not as pronounced as in other parts of the world, and there still remains a lot to be understood from this. Think about the emergence of variants from Africa. We had emergence of two major variants from South Africa, if I remember well. The Beta as well as the Omicron variant all arose from South Africa. Were there other variants that arose in other parts of Africa that we could have missed? Well, if we were not looking, we will not see. If we do not see, we cannot act. And this is why clinical trials and surveillance and other research activities are so critical. And obviously funding is needed for this. So what I think we need to do is to find a way of embedding clinical research, including trials, into routine clinical care. This is what we refer to in my group as the golden space. This golden space is creating a culture, where you have clinical research embedded in routine disease prevention and control activities, including treatment or therapeutics. And for this, funding of various registries for important infectious diseases, as well as non-communicable diseases, if I may say, creation of various platforms that can address ethical and other regulatory barriers, and just capacity building so that countries and research facilities and clinical care facilities can be what we call research ready to run in parallel with the routine clinical care that is needed in times of an outbreak. So bear in mind this golden space where research is not considered as a separate entity or separate activity from the delivery of routine clinical care or health care during an outbreak. I'd like to speak in this context also to the engagement of researchers and government. It's so critical that researchers and governments engage, especially in our country, Ghana, There is, I think, a pretty healthy relationship between the research community and the political actors, i.e. government, although occasionally there is friction, especially where the research is perceived as not making government look really good. And this friction does exist in every part of the world. But we perhaps as researchers owe it a duty to help political actors to appreciate better this space called research and how it plugs into the routine service delivery within the healthcare sector. In doing this, however, we need to be very cognizant or highly cognizant of maintaining research independence, where researchers have the opportunity to independently come to a conclusion about what is really important and necessary, have the independence to conduct their research and to put out findings without necessarily having to engineer their research with the objective of pleasing a certain government of the day. And ultimately, being able to interface with government in such a way that the uptake of research findings is optimal. It's really optimal. And also positioning ourselves well enough so that government is happy and eager to fund research because they see the utility that this brings to disease control and prevention, especially during outbreaks or epidemics. Still going on, I'd like to speak to the clinical research and regulatory landscape, where you're thinking about your ethics committees, your clinical trial authorization, and various institutional and other permissions. These take time, and we need to have a system that is both nimble and robust so that, of course, corners are not cut. And we know how here in Ghana we have a really stringent, highly competent ethics committee in the Ghana Health Service Ethics Committee, and a really, really world-class FDA, which does a solid job of reviewing various protocols. But as researchers, we always feel that this takes way too much time. How can we position ourselves as a country so that we can do this quickly and yet maintain that robustness and that stringency that will command respect and confidence of the global community? These are discussions that we need to have, and discussions that call for funding to have these structures in place. Electronic submission, how can we facilitate this versus the tons of paper that need to be submitted, original copies involving transportation and all that. Across Africa, we've had the African Medicines Regulatory Harmonization Program, the AMRH. There's also AVAREF that seeks to harmonize things across the continent, and Ghana is playing a leading role in this. However, with regard to the funding, we're still lagging behind. Are there any continent-wide bodies that can fund big-ticket, clinical research, clinical trials that are of importance not only to Ghana, but also to Africa? How can we set up perhaps an independent funding body in Ghana which could address the need for funding of clinical trials and other clinical research? Could, for example, the COVID-19 Trust Fund be morphed into some kind of independent or semi-autonomous funding body that would receive funding not only from indigenous funders, but also funders across the continent and globally, and funnel these in a transparent manner to researchers in country? This is an exciting prospect, and I think we should talk more about this and see how we can turn it into a reality. There's also the need for us as researchers, together with government, of course, to develop country and region-wide ready-to-go protocols, what we call sleeping protocols for various kinds of clinical and other research, so that we don't have to start from the scratch when something arises. We have these protocols that are ready, which can be quickly transformed into active research. In fact, this is what helped quite a bit with COVID. There were actually sleeping protocols that have been developed to address an outbreak of respiratory type pandemic. I'm happy to say that I was part of a group that did develop this, and so we were able to move very quickly to initiate studies in China and other parts of the world. Also, I've spoken to this already about the need to harmonize clinical research, and thankfully we have the Africa CDC, WHO, AFRO, the African Academy of Sciences. All these are organizations or bodies which we need to interface a bit more with in order to harmonize some of our activities across the continent, because when it comes to outbreaks, especially outbreaks that go beyond the country, simply having solid country policies and research capacity, etc., alone will not suffice. It needs to be a region-wide effort. I'd like to now speak to gaps in the ecosystem and the complementary role that funders can play in here. Now, when we say the ecosystem for research, we're talking about a system that allows for exploration, that promotes an inquiring mind, or that promotes inquiry. A system that has a stringent and reliable regulatory system, or that has a stringent and reliable regulatory bodies. A system that is constantly adapting and is still active. So, for example, we are now talking about adaptive platform trials. Our regulatory systems, and including ethics and FDA, are they primed enough to be able to address the challenges that come with adaptive platform trials, where you may be ditching an arm and taking on another arm really quickly, but you still need to go through that whole process of protocol amendment, payment for it, and the long process of review. How can we improve such a system? And of course, the need for a multidisciplinary system, because you're talking about outbreaks and funding of research, and you need to be able to quickly translate these research findings into policy. And to do this, you really need the context. And this context you can only obtain via multidisciplinary research, and not just clinical research or clinical trials in silo. So this is where I make mention of what I call similitude, so similitude for synergy and diversity for innovation. I'll speak to similitude for synergy. First of all, the need to have some kind of aligned or a well-organized funding system, which clearly identifies focal areas which are important to us as a country. These focal areas, I recommend, are arrived at both in consultation among or between researchers and key stakeholders, including government. Also the need for promoting excellence, high quality, global standards. How many of our research institutions and labs have ISO certification? How many have SLIPTA certification for labs, for example? And also just those basic skill sets and promoting the research environment. So I've talked about the similitude for synergy, now the diversity for innovation. In as much as we want to have some kind of a coherent structure, we still need to make room for diversity, because without this room for diversity, we would lack some innovation. Diversity breeds innovation. In this case, you want to have these opportunities for rapid response to some idea that comes to a researcher to explore something that nobody may have thought of. So those off-the-grid questions that may come out, do we have a system to fund those, to do this quick proof of concept type of research right here in Ghana? There's also the element of risk. I mean, the research might just fall flat. And then what do we say, what do we do? How do we put forward this risky aspect of research, but also show that we need to take these risks in order to foster innovation? And then this culture of pushing the boundaries, and really being able to go into spaces that we may have never ventured in before. With that being said, still be cognizant of key challenges which I'll summarize, most of which I've mentioned already: the ethical clearance delays and challenges with authorizations, the need for trainings and building capacity. Sometimes politics gets in the way of funding and gets in the way of research, especially during outbreaks, pandemics, epidemics. The need for consistent surveillance or monitoring and setting these systems in place. They are expensive, and it's a challenge to demonstrate the benefits or utility of monitoring or surveillance, because when monitoring or surveillance is optimal, your result is really no problem. and to show people that, okay, there is no problem, so our work is actually going on well, is sometimes a bit paradoxical and a challenge. How do we show that the absence of trouble is actually evidence of the effectiveness of the work that we do? Then the mobilization of resources, I've talked about this already, the need for tools and technology. How far are we harnessing AI in our unique space? AI never exists in a vacuum. It exists in context. And within our own rich cultural context, not only in Ghana but in Africa, how are we harnessing AI and its utility? How can we be quicker and put out output that is relevant? And of course, this constant race against time that we have to deal with. And with that, I want to end with three key points that we need to bear in mind. One is the speed, the need to move quickly, mobilize the funds, and get to the job. Second thing is the flexibility. How can we be flexible with the funding options and funding opportunities and move with the tide? And finally, how can we, when we've done the research, when we have the findings, how can we move these quickly into policy, which is the uptake. And with that, I'd like to say thank you very much for indulging me. And once more, apologies I couldn't be with you in person. I look forward to engaging further with you. Thank you very much.
Okay, that was different. And we thank Dr. Mwasi and his team for putting together a very informative presentation. Now, we have reached another open forum where we will have a general discussion about everything that we have listened to today. And Professor Paul Amuna is going to lead that session. And so let me bring him the mic so that he doesn't have to go up there. Prof, you have the floor.
Right, okay. So at this stage, the first thing I would like to say is that we should have asked the presenters to grant us permission to share your slides. So normally this is done at the beginning so that at least because the chairman was telling me that it would be useful to have some of the slides. So if the speakers, if you don't mind, we have them on the computer, so we will, but we'll have to have them PDF'd so that people don't go and start using them without proper permission. But this afternoon, we've had three very interesting presentations. I think this morning was very exciting and stimulating. And we went to lunch feeling really good. And I looked around and noticed everybody was awake this afternoon. So it means we're very much engaged with the presentations. The first one was given by Stephen Atesige from Ghai, where he started by sharing with us the objectives of Ghai and the ways in which they try to work with various stakeholders in order to advocate for public health. And I'm sure listening to them, listening to him, you may have some questions that you want to ask. And then the second presentation that was made by Dut Esquire, if I'm right, the Honorable, also looked at the legal framework and how we can sort of do these things. And then the third one was looking at the funding of clinical research in relation to public health emergencies and preparedness by Dr. Mwesi. I want to open the floor for people to raise questions so that the speakers who are here can respond.
And then if we can respond to any other, then we'll do so. But one thing that I am taking from all the presentations this afternoon is that there is no question about the need to have funding, this funding. There is no question about that. The second point is that everybody is going back to the 1%. And it seems to me even the last speaker talked about the 1% being repackaged and for it to now include funding for research, for preparedness. So the floor is open. We'll start with 2 or 3 hands and then we'll continue from there. So anybody who's ready? I can't see any hand on. So, yes. Thank you. Do we have any questions online? If we have any questions from those online, you can ask questions. Those of you who are online, you can also ask questions. So you can just put your questions in the chat box and we will respond to them. Please go ahead. If you just mention your name and your organization and then your question. Yeah.
So I'm Juliana. I'm with Uhas Nutrition and Dietetics Department. So we've said all these beautiful things, and the fund seems to be centering around the 1% COVID, as we all have through the presentations. So some of these policies are very, very interesting. Like the Ebola trial some time ago, when we wanted to do it, it was a very nice trial, but when it got into the public domain, it got shut down because the messaging did not go right, the public sensitization and how to go about it. So at this forum, how are we going to package the message so accurately to the barest understanding of everybody that there is the need for this 1% to be renamed or rechristened into, so that it doesn't get shot in the public space? Thank you.
Thank you. Thank you very much for that question. And your question is, how do we advocate for the 1% to be repackaged and to be used for the purposes for which we are discussing here? And that brings me to one thing that we were thinking about when we were preparing for this, that at the end of this symposium, as we have heard from all the speakers today, we don't want it to be just another talk show. One of the first things we want to do is to produce a communique which will go out there. Is there anybody from GNA here, the Ghana News Agency? Do we have anyone from GNA? This morning I saw TV. Was it TV3? There was TV3. Okay, so they left early. Okay, that's fine. But they may have captured some of the things. Yes, please, go ahead.
Thank you. All right, thank you very much. I just want to touch on the question. It's good to know that we all seem to be on the same page. Not even this symposium, but over the time in our engagements with stakeholders, even some people within the Ministry of Finance believe it's something that can be done. I've spoken one-on-one with some technical people, even with the Ghana Health Service, and they believe it's possible. However, what seems to be a concern is how the access is made. Now, if we say we want government to repurpose that fund or the levy for epidemic preparedness, it may be a little seen to be a little too much to ask for. So there has been proposals to be specific with a proportion of that fund to be dedicated for that. So this is the trick, that at least you go asking for something, you go at least with a more modest or a humble ask, you know, to see the response. And probably if we say, okay, why don't we allocate 30% of the annual, revenue from the levy. An example I'm trying to say, I'm using 30% as an example for a public health emergency fund, a seed money to start with. Probably that could be, okay, then over time we can say, okay, let's increase it because there's the need for it. And hopefully when we have that vehicle set up or the fund in place, then private sector and other development partners, as we've all discussed here, would see that seriousness or that initiative to support, through contributions as we've saw with COVID-19. Sure.
Thank you very much. Dr. Dut, you want to...
What I don't have, you see, it's good. The professors, we want you to know, and you continue to give these lectures to a lot of people, including politicians. So you tell them that it's good to look at setting up a health fund. But in addition to that, we should also hammer on setting up the Ghana CDC. As I keep on saying, when there is an epidemic, you are not sure which organ is going to act. Because it is only the Ghana Health Service. And the Ghana Health Service cannot tell police hospital, bring me report. So if we had that kind of organization, and you cannot establish the organization. I have looked at the CDC for US and the Africa CDC. Funding must be part of it. So if we could establish that Ghana CDC and use this 1% to fund it, and that Ghana CDC cannot talk unless there's research, unless there's academia, unless there is also practice. We need that kind of body that can bring everybody. So I don't know how it will be done. Maybe the advocates, if they can write a petition to Parliament and something. But the most important thing is that you form the critical mass that will support the idea. So the Send Ghana, I know they've already sent a petition. And the NGOs behind, USAID, they are all pushing the government to do something like that. Because they say next time there's COVID, don't come and beg. Come and tell us what you have before we will give you. That's it.
All right, thank you. I think this morning Emmanuel, you were making some points with specific reference to this particular issue. I don't know if you have anything you want to add to what has been said so far. But I think the point that was being made was that we owe it to convince the public, to get this message out to the public so that we can start to conscientize people in terms of the need for us to have a fund of sorts, whether it's coming from the 1% or not, or a certain proportion of that is another matter. So we would like to hear your views before we go on to the next.
Okay, thank you. So your question is very important because you need to carry citizens on. And as I indicated this morning, we've also, as part of it, doing citizens sensitization or awareness creation on the entire issue about public health emergencies first. And then the fact that we need money to fund that. And our call for government to convert the COVID-19 health levy into a public health emergency levy to fund the public health emergency fund. And so this is something that we've been going around. At SEND, we do what's called budget inputs. And so in our budget input for These are some of the things that people have also been talking about. So yes, we will do that targeted one as well. We also work closely with the media. We have some media as influencers. So I was talking to somebody, I think before we went on break, that between Sen and Ghai, we've been able to come up with what is called the Journalist Award for Epidemic Preparedness and Response Reporting. That will encourage the media to go down to take stories themselves. So this is not like Ghai or Sen pointing them out to cover stories, but they will go to do human interest stories. It could also be technical stories. It can be coming to somebody within the academia to talk to the person about the research he or she is doing. Initial thinking was for us to collaborate with the Ghana Journalists Association. So, you know, they have this big journalist award. The idea was to use that platform. However, upon careful discussions with them, the thinking was that, no, let that be separate. And so now there are some media personnel who are actually covering some stories in that light. And some are also using that platform to propagate the agenda. And so that is what I would say in respect of the media. Upon hindsight, what we need to be looking at is the local radio, community level radio stations, which we've not used as much. At Sangana, we use community radios a lot. But on this particular focus, in terms of trying to get buy-in to establish the fund, we've not used the community radio so much. But I think we will be thinking around how we can use them to prosecute this one as well. I hope I've been able to do justice to. Thank you.
Thank you. I have a question that has come in online. It is from Balama Gado to everyone. She says, we agree that academia has a very important function in emergency preparedness and response, especially with regards to providing the evidence. So how do we push in for the findings to not just end up in journal publications, but be used to make decisions?
So our academic partners here, please note that question, because I know this morning there was some reference to that. And I think it was from our colleague from UCC. So the question is, how do we break the evidence down, translate it so that it will be properly disseminated for people to make use of it? I saw a hand over there. Yes, please go ahead.
Thank you. Irene from Uhas. Interesting enough, I think you scanned my mind, Prof. I was going to ask how the community at the lowest level is going to have this information such that when you bring it up there at national level and there are debates, when the grassroots, when the common ordinary member understands the value of health emergencies, then they're going to demand that government responds favorably to such schedules that what we are having. And so I was just telling him that you are just delivering my message. Again, then one online also hit mine, because I was going to say that how is Ghana Health Services managing such that funds that are available for research is made available online maybe, such that if my interest is in this area, I go online and I see what funding is available to me as a researcher or a student, and then I opt for it. Then the outcome becomes valuable to Ghana Health Services or whichever stakeholder did put the funding out there. And my personal one is a recommendation that if tertiary institutions if we find this agenda as a national need, then I recommend that in every course that is run by tertiary institutions, whether it is administrative, whether it is funding institution, whether it is scientific research institution, we find a way of adding health emergencies as part of an aspect, if not the full course, but aspect of a program. So that if you talk about an administrative person, he has information. If you talk about somebody who is learning finance, he has information. And then it makes it very easy for the uptake, and then we all push it. Thank you.
Thank you.
Sorry, Prof, just a quick information. So also as part of the idea to get everybody on, we have what is called champions. So even at the community level, we have some civil society, some NGOs at the local level that we call them focal NGOs. So in certain districts that we are using as champions, of course, at the community level. Also, we have some selected champions from members of parliament. Because the idea is that once this has to go through, definitely it will go to parliament for approval. And so we have some parliamentarians who are, you can call it EPR champions, who will be championing the cause. So we have all these people, some religious leaders as well, also to do that. So that's our approach. Thank you.
All right. Okay, so there's a hand here, Prof. Nako.
Yeah, my name is John Azari from UDS School of Public Health. I think that we all agree that it is necessary to have the fund set up. But there are two critical questions that perhaps we still need to address. And I think as part of our responsibility as academics, we need to ask these questions. I still think that how do we grow this fund? We all agree if COVID's fund is converted, then it could be a starting point. However, beyond that, what next? In my mind, have we explored the possibility of involving the pharmaceutical companies? These are bodies that benefit a lot from the health sector in terms of emergencies, etc. What role can they play? How can they come in? And what will be their contribution to this kind of fund? But the other question, which is also critical, is accountable use of the resources or the fund. And I would like some clarification from the legal team. Perhaps you showed us a framework which is very catchy, but in it, the Ministry of Finance still sit in there. How do we manage them? Is there a way behind, within the law that we can set up such a fund without necessarily having the Ministry of Finance, linked up to it? Otherwise, at the end of the day, if everything has to go back to the Ministry of Finance, then it will be difficult managing the fund different from what we are seeing with NHI. So does the law allows us, can we navigate it such that this fund can be set up and managed by the professionals who know how to deal with emergencies when they arrive without involving the Ministry of Finance, as we have seen in your framework? Maybe you would want to comment on it. So thank you very much.
Yes, just to add to what he said, I think now we all agree that we need a fund. And looking at the current economic situation in the country, if I'm the president and you come to me that the money I'm using to pay salaries, and we know that they are using the money for other things. So if you want me to even divert 5%, they know that we need to have the fund, but now we don't have money. We've gone to the IMF. We are looking for. So I think we have to go step by step. Let's demonstrate and let the ministry say we need a fund first. Once they say we need a fund, then we go to how do we fill in there. We had some discussion about 3 years ago with some colleagues from CDC. And there are a few countries which they said, because public health emergency affects cross-border surveillance and border control, there are few countries that they convince the leadership. We can add just about $5 to $10 as tax for everybody who cross our borders. We can only start with the airports. During the COVID, now, Ghana, a lot of people pass through Ghana. So if you are adding just $10 to your ticket is $2,000, so 2010, you will not even see that is there. And that alone will be the starting point to get some money that can be used without asking Anado to use the 1% that he's using to balance some other budgets. So I think that could be a starting point. And from what he said, pharma company, there are so many ways that we can do to fill in that fund. But we have to demonstrate that we need a fund and that we are not going to worry government to take money from what he has now, since he's even looking for more. So that's my suggestion. Thank you.
I knew this point about the pharmacy or the pharmaceuticals would be of interest to Prof. Binka, and I'm sure he will have some points to make on other issues as well. So we'll give him the mic.
Yeah, so thank you. I just been listening to since morning, and people have raised very pertinent issues, and let me also emphasize the positive part first, that we agree that we need a fund. The issue is, how do we get this going? So let me take the pharmaceutical group. I think they will make a contribution. They should be part of the group that will build and help us to grow the fund. But I worry about the airport tax. France started with the airport tax, and it has a whole institution that has been funding lots of things in the NTDs and in malaria. I think in our current state here in Ghana, if we introduce a new tax, it will bring a lot of fight. I think the people have had it enough. That's why we have to go back to chase President Akufo-Addo, since he himself created the tax and called it what? COVID tax. All we want him is to change the name and put a different emphasis on it. It was his duty to make sure that we prepare for the next pandemic. He's not doing us a favor. You know, we've just gone out of one. We all globally know that there will be a next one, but we don't know the date. And since he's there now, it is his duty to make sure that we can grow the tax, create a fund and put resources into it. But on another level, I was trying to talk to Send and others. There are a couple of things that are not allowing advocacy to flourish in our part of the world. And as we spoke this morning and this afternoon, one of our big hurdles is going to be Parliament. And I don't know whether there are a couple of things that I personally not very happy about what goes on in Parliament. They are the people's representative. But they are the last people that Vice President Bawumia is targeting for his digitalization. We need to emphasize the digitalization there so that we know what you vote for. Not shout, hey, the A's have it, the no's don't have it. No, we have reached the place where when you go to Parliament as a parliamentarian, you vote on the issue. So we can track your track record, whether you are just there to vote things that your constituents don't need and so on. I think that's what helps people in the US. And I don't see the reason why in a hung parliament where the difference is one, they're still shouting. I don't see how you hear the difference in the shouting between 100 and 99. But Bagwin does that very well. So I'm not, his ears, we have to examine them and use them for research. So if we did that, I mean, it's not only for this time,
But we need to know what our representatives are doing. Because otherwise, they leave us in a situation where it's as if the things that we are driving for are our personal things. No, we want improvement in the health of our populations. So think about that also. So that to lobby people will be easier, knowing that this is this guy's approach to these things. I mean, as I was saying after lunch today, if you could get 2 people on each side, just 2 in this parliament, they can change the course of the world. 2. It is the most critical point in our development. Only 2 members of parliament can give the president and his executive a real hard time. But nothing is happening. We are having all these funny things. So the tax is the low-hanging fruit. Let's focus on this tax. Let's try to change it to become part of the Public Health Emergency Fund. Once we do that, we can grow this tax. We can get many partners who will put in money into this tax, especially if it is not into that bottomless, what do they call it? Huh? No, consolidated fund. That is what our partners don't like to hear about, because anything that goes into the consolidated fund is slash money. They never account for it. Nobody accounts for it. They use the money to do what they want to do. So if we just focus on this, I think we will get there. Thank you.
Thank you very much for that, Prof. And I think just to buttress what Prof was saying about the tax, we already have the ECOWAS levy. Is it still there or is it gone? So we are already taking money, and I don't know what we use that money for. But I would like us to address some of the questions that were asked. There was a question about the Ghana Health Service and Research. I know that there was a policy to use 5% of the monies. I think, Professor, you were part of this. It was Ministry of Health. Oh, okay. Right. So where is our friend from the ministry? Dr. Atiote. Yes. So if you can help us about the 5% that was supposed to be ring-fenced for supporting research. Is it still there? Okay. So we will not worry you. But what happened to it? Do we know? It's gone into consolidated. Okay. So we will. I think Professor Todd, you wanted to say something.
Yeah, just a quick one.
And then we'll let the people answer respond to the questions.
Yeah, just a quick one. Why I agree with Prof. Nyako about the airport tax. Gambia charges $20 when you go into the country and $20 when you leave. And I believe that this wouldn't bring any hue and cry. So if it becomes a regulation, charge $10 or whatever, and people who are coming to the country would pay that money without realizing it. And I think that would be a good way, in addition to the 1%. Thank you.
Let me say this. You see, if you read the Constitution very well, you can't just impose tax. So the way we are looking at it, you just can't impose tax. Tax that is why it is in the Bible. It's the only one that Zacchaeus was mentioned in the Bible. Others, look, you can't just impose tax and say, oh, $10. No, it's not done. It cannot be done. It must go through a certain system. And I'm saying that, don't look at it. The 1% we are talking about, if we were supposed to focus and repurpose it, I'm saying last year our analysis showed that it generated almost $500 million. That is more than enough. If Uhas gets $1 million, things will change. So the truth is how we are managing the fund already that what we have. Rather than thinking of even adding $10 there. And we were charging $80 something at the airport. Out of that, just 10% was given to the airport company. And the other one went to Frontier Health Services, registered in Nigeria. Is that not it? So managing the money we collect is critical. And so that is where we should be. And so just tax is not just easy to impose. And then the young man was talking about Ministry of Finance. You can't do without them. You cannot collect money. You are a researcher. So you can't say, can I establish a fund with the Ministry of Finance? Who will collect it? That is their job. It is part, it's in the Constitution. They are entitled to collect the money. So there's no way, and there's no any other organ that will collect it better. If you think Ministry of Health will collect it, you try them. It will be worse. So please, it's not as though there is another saint somewhere who, when he collects, he will just give all the money to you. He cannot even keep records. So please, Minister of Finance, I think, but let's all agree and focus on what we have. 1%, I can tell you, is a lot of money. It's a lot of money, yes.
Okay, so thank you very much for that. We'll come to some more questions, but I think you have made some very important points. There are legal issues. There are issues that have to go through the parliamentary system and so on. And even as institutions, as public institutions, remember, we cannot open an account without authorization from the Ministry of Finance. So these are things that are very important. Earlier on, somebody talked about introducing emergency preparedness into our programs and things like that. And I think that's a very good point that was made. In the morning, people were talking about harmonization of our programs so that across the country we can speak with the same voice. And that brings me to a point that Prof. Binka has been discussing with me, that we have the Association of Schools of Public Health in Africa, ASFA. And now we have at least 5 or 6 schools of public health in Ghana, and yet we do not have a national association of schools of public health. I think we should think about it. And we are going to contact our counterparts. I was speaking with Professor Yidana earlier on, and we'll speak to the other deans and then see whether we can start some kind of group like that. And I think that will be helpful to us as well. The other thing is that today our focus here has been on advocacy. And I realized that, as I said in my welcoming remarks, we don't know how to sell what we have. And I think there's an opportunity here also for us to bring advocacy into our curriculum and to make sure that we partner with our civil society partners who are experts in this area to actually help us to, I know you are working on, you mentioned it in your talk about developing the framework and then coming up with some kind of curriculum which can be used by institutions. We'll look forward to that. Okay, so I'll now go to the academia partners. There was a question, Prof. Preko, you want to respond? Please go ahead.
Well, thank you. Well, I believe that in communication, they say you must know your audience. And we have varied audience that listen to us, from the community level right down to those who legislate for us and all that. We need to learn their language and what appeals to their ears very much. For the community, I think they seem an easier group, but they are widely a very complex group, which we need to translate our research much more towards their day-to-day experiences in trying to let them appreciate the key things that are around whatever we are trying to advocate for. Same with the other audiences that we have, which we need to change our work. Part of it had been the development of policy briefs, something that will speak so straightforward to an issue, or fact sheets and all that. These are some useful ways which we can appeal to our audience at the community level, as well as within the different sectors that we approach. So this is my little addition to that. But I wanted to also clarify something that was said in the morning. It is not that NADMO is to take authority. That was not the import of it. What we're trying to say is that we have institutions that are working, which needs reforms. And so in addition to looking at all these things, we need to reform those institutions so that it can make them much more useful to our quest. Thank you.
Thank you. Right. So can we just take two more, and then, yes, there was a hand here. We'll come to you.
Okay, thank you very much, Prof. My name is Joseph Tete Afangbe. I'm a community champion for St. Ghana at K2 South, and I also double as the youth representative of CSO platform on sustainable development goals in Ghana. I will say that I'm part of the advocacy champion or organizations that are championing the advocacy at the district and the community level. And the challenge here in most of the media engagements that we have engaged in so far, the fear of the establishment of the Public Health Emergency Fund is actually a challenge, when it comes to the public. So they ask, so do you think that when the fund is being established, it's going to be well managed? So I was happy when the presenters actually, provide some of, their presentations actually answered these questions. And I think it was very educative. And I would also like to touch on the autonomy of the fund. This morning, Dr. Emmanuel mentioned that the fund is going to be independent. And in the submission of Professor Binka, I really enjoyed that presentation. One of the recommendations were that a retired finance minister will be part of the management of the fund. So I want to ask, if it happens that way, and then in Doctor's presentation, Dr. Emmanuel's presentation too, he also mentioned that the process is going to be, passed through the Parliament, Ministry of Finance, and the, Ministry of Health. Do we think that at the end we're going to have, an independent, fund? That's my number one question. And then my submission has to do, since I represent the user platform on SDGs here, last week we had an engagement, and we also looked at a situation whereby, of course, in as much as we want the fund to be independent, there is a need for us to look into it together with, partners, CSOs, religious leaders, so that we take off the government's, hands, in it. So that is what we are looking at. And then from the district level, we have also had the opportunity to engage some district, officers. When it comes to the source of the fund, one critical thing that they proposed is we having or engage the government to provide part of the property rate, to be used as one of the sources. So basically, that is what I have to say. Thank you.
Thank you. Please, my name is Oman Alberte. I'm MPH student at the Fred N. Beacon School of Public Health. My question has to do with how the fund could be protected if it is finally implemented. And that has to do with what are the legal provisions that will ensure that when the fund is finally established, people wouldn't tamper with it. If not at all, it should minimize or restrain people from tampering with the fund, so that we'll not see what has happened with the COVID-19 fund, where people has just misappropriated it. Thank you.
Sorry, whilst our moderator comes, I just want people to understand something. We are at the very foundation level, asking government to agree to establish the fund. Full stop. Once they have agreed, all the other things, how we are going to grow it, who is going to contribute to it, how civil society will come, that one will follow. You see, let me give you a proverb from the north. You know, somebody said that he told his child, the child said the father is going to, he said he's going to buy a donkey. And he said, oh, if you buy a donkey, the donkey will give birth, and I'll be riding the small one. And then the father beat the child. Just knocked the child down. But you haven't bought the donkey. And the child said, I will ride the donkey. And you are so much annoyed that we don't ride small. So if we are not careful, we will raise the issues, the difficulties, whilst the fund has not been established. So please, that is where I just want everybody to understand. And so if you want to travel to my hometown, you are looking at the mountains, you climb, and then you just remain in Who. You just wait. When the fund is established, and you want to grow it, and you want to manage it, and you want to do. So now, the advocacy should be, as Prof said, Akufo-Addo should change the thing to Public Health Emergency Fund. We start with 1%. If they say we should take 50% of that, we agree. As we go, we will now see how all the others will come. Otherwise, if you are not careful, in any case, the 1%, they have a way of using it. So, what is it?
So, yes, I'd like you to go back.
Okay, so this is an address to a question that was put, how academia can break down their research to engage the community. Yeah, so apart from publishing our works in the high impact factor journals, we have to engage. So I gave an example of what we are doing at UCC. And I think this is not just peculiar to UCC. We now see in other media landscapes, like on BBC, DW, and even on Joy, you can hear me? Yes, they now have aspects where they publish issues about health research, where people have conducted research, and they try to break it down. So we can, as academicians, engage with the media, where we can now put out our work, break down the jargons, and let them understand, especially the works that we do in the communities. It's always important that we can do this also in the local dialect, so that the people can understand. And then when we talk about advocacy, they'll be ready to support because they have first-hand information. Thank you.
Thank you. You want to say something? Yeah, go ahead.
Thank you very much. My name is Gladys Kaba from Uhas, from the Department of Basic and Biomedical Sciences. And since morning I've been here, I've been hearing two different names for the fund that we are trying to establish. One is Public Health Emergency Fund and Ghana CDC Fund. I think that's what we are looking at. It's like people are trying to say maybe the fund name will be Ghana CDC. Oh, okay, but I think I heard from Prof. Binker's slides or presentation that because we have an African CDC, maybe the name Ghana CDC might be well taken. And that is where I have that's the two different names actually I'm kind of reflecting on it in the sense that I do basically basic and biomedical research. And as a public health emergency issues that crops up, we have the basic and biomedical scientists also playing an active role. And if we don't take care and the name kind of, it does not seem to include everybody, some of us may think, oh, it's a public health kind of thing, so let's leave the public health to do their things whilst the basic scientists do their own thing. Because I foresee this, maybe it's something that maybe I'm foreseeing, because when I was in University of Glasgow, when the pandemic broke up, I realized how active the research center I was, though most of us were not a typical like public health experts, but the basic scientists were very active. So if we don't take care, I'm foreseeing some danger there. So maybe we might think about the name that will encompass everybody, because we have even the nutritionists, other people who also come in, who are not public health experts, but they are also they can also play a very good role. Thank you.
Okay. So, yeah, I think Prof. Binka wants to clarify. Yeah.
So thank you for raising it. I think it's simple. In fact, we are following the same track as you're trying to follow. At the moment, what they are trying to establish is a unit which represents the CDC, but is under the Division of Public Health. And we are saying, no, this should be an agency outside the ministry that will bring together all the stakeholders, from your nutritionists, your basic scientists, and so on. I mean, the basic scientists were the ones who did the tests to test for the COVID and so on. So that's where the two differences are. But we expect that this fund, which is the Public Health Emergency Fund, will fund the CDC. Okay? It's not that it is the name of the fund, but we expect that because of its work for emergencies, it will fund some of the work of the CDC.
So thank you very much for that clarification. I think we've had a very good day, and Emmanuel wants to say something, but we'll come to you. And there's a lot that we have discussed. We were hoping that we'll have a draft communique here before we leave. Usually when we go to these meetings, we'll sit down and then we'll crash it, and everybody will agree before we leave, but I'm not sure we can do that. We are still warming up, so what we are going to do is we'll have a small group that will put together something, and then we'll share it with key people, get some inputs, and then we can get it out there. I think there was a suggestion from somebody online, but we will, Emmanuel, do you really want to talk, or you're okay? Yeah, I think, yeah. So we will take that, and then we'll bring this part of our discussions to a close, so that we'll hand over to the chair to wrap it up for us. So Maria will read the comment from online. Thank you.
Okay. All right. Thank you, Prof. And so there was a suggestion. As a matter of fact, there have been several, there's been a lot of commentary online, but most of them were just reacting to the wealth of information that we were getting. People were, appreciating the various speakers and all of that. We cannot read all of those here. And we did not have but the one question which we asked earlier. So this is the suggestion that came in from Adam Kojo Janto, and he says that such a symposium as this one should have some of the key policy makers, such as MPs, ministers, etc., invited. And then he gives an example of, he says, like the LGBTQ bill currently making news in Ghana, because it has key MPs pushing for such a bill. He's suggesting that if we really want to succeed with the Public Health Emergency Fund, perhaps in the next series of symposia that we organize, we should include some of these decision makers and legislators. I think that's a brilliant idea. So thank you, Adam Kojo Janto from Binka School, Uhas. Okay, and I also want to remind those online Please, in the next couple of minutes, while we listen to the chairman closing out her remarks, please turn on your video so that people who are monitoring Zoom can take screenshots of you. As part of the photos that we're taking, you were also present, and so we would like to capture you as well. So from here on out to the end of the program, please keep your cameras on so that we can capture, have screenshots of your faces. Thank you. On that note, may I invite our chairperson, Professor Ansa, to give us her closing remarks.
Thank you very much, and thank you all for staying through till this time. I began in the morning by emphasizing the need for us as a country to be self-sufficient and to be prepared for epidemics, because when COVID hit, we learned some lessons from COVID. And one big lesson we learned was that when all the borders closed and everybody was in their own country, every country was to themselves, and everybody, God for us all. So I started by emphasizing that. But I've been asked to do a summary, but I will not be able to do a summary of all that has been said. I will highlight some key issues, which hopefully some of which can go into the communique that I heard, that stood out for me. What we have seen is that preparedness is a key issue. We have seen that, and we have all agreed. And we have realized that as a country, we are not actually starting from ground zero. There's a level of preparedness that we as a country have actually done that we can pride ourselves in. One of these is that we have signed on to the international health regulations as a country. And we have actually gone ahead to prepare a costed action plan. And we have gone on to even develop about 5 different policies, all of which have a clear statement about being ready to detect, being ready to respond to epidemics. So we've done something. The other thing we've done right, and Prof. Binka has been part of doing this right, is setting up this training of field epidemiologists. That is something we have done right as a country. The only thing we haven't done is putting our money where our mouth is. That we haven't done. Even though we have done everything right, costed everything, pushing the money in that direction has become an issue. So we have talked about all of this. So people then have made calls for the setting up of this public health, the preparedness fund to help us to deal with emergencies. And they did not just call for that, but several people pointed out places that we could get money as seed capital for this fund. And one of these is the COVID-19 fund that the president has said will not be withdrawn. So it means it's still there. And we've been told that this year we should be able to get about 2.3 billion from that fund. And so we are, as a group, people have made a call for some of this money or all of it to become the seed capital for this. And this has been emphasized here. And several people have pointed out where we have gaps to do. Even though I've said we've done something, there are gaps. And the WHO rep pointed out other capacity areas that we need to do to be prepared for this. And people have also pointed out a very key thing, making the money have a short distance to travel to where the action is. and not go round a long distance, the travel time from different areas to before it arrives at the district where the action is. So that short travel time has been emphasized, and that is important. People have also emphasized ways of managing this fund so that it doesn't go the way of other funds that have come before it. And this we need to take note of. The final thing that people have emphasized is the fact that at the district level, there are certain structures already at the local government level. And that is really where, when an epidemic or pandemic hits, that's where the action will begin. And there, people hinted at the public health emergency management committees. These are there. The structures are there, but they are not being used. So strengthening these right at the local level and ensuring that they are ready to act are issues that people have talked about. And so I think we have had a very fruitful deliberation. We have looked at where we are doing well. We have looked at where we have gaps, and we have seen the importance of setting up such a fund to help us to deal with the next pandemic when it arrives, because we would have been fully prepared. I want to thank all of you for allowing me to chair this session and for the fruitful deliberations that we have. And I wish you a good evening. Thank you.
Okay. Thank you. Thank you very much. Okay. Thank you, Professor Ansa. And all right. Professor Ansa, thank you very much. And like I always let people know, if you don't know, she was my classmate from 1 to 5. So we've known each other since we were 12 years old. And the smartness was all around. So, she was a genius in secondary school. But I'm also here, so I can hold my own. Yes. I'm a very avid consumer of her work, a professional patient. So, Professor Ansa, we thank you. At this point, we will call upon Dr. Pearl once more to come and close us out. Mavis Pearl Kwabla, lecturer, Fred N. Binker School of Public Health. Thank you.
Thank you. Shall we close our eyes? What shall we render unto you, our Heavenly Father? It has been a fruitful deliberation. Father, we are so thankful that you have stirred the affairs of this gathering. We thank you for all the ideas. We thank you for all the brainstorming, all the strategies you've given us. We pray that we will put this into work. Father, we thank you. Even as all our participants, all our guests will be going back to their various destinations, we pray in the name of the Lord Jesus that you would take everyone to their various destinations. And Father, we will not forget to give you thanks. We thank you and we give you all the praise. In Jesus' name I pray. Amen.
Thank you, Dr. Pearl. On that note, we have come to the end of this wonderful event. We look forward to the next one, which I'm sure we will double in size, at least, the next round. And as I was told during discussions, this is probably going to be an annual event. So we look forward to that. We thank everyone who has been with us online via Zoom, as well as watching us on Facebook and our YouTube channel. Please, have you taken the pictures? Have you done the screenshots? Anyone who's still online, please turn on your video for a quick second so that we can screenshot you and have it on record that you were here. Everybody, video on. Can you hear me? Are we good? Okay. Screenshots, are we going? Next page. And I believe we're done. Thank you very, very much. And we will see you next time.